Good afternoon once again, respected dignitaries, esteemed guests, speakers, delegates, faculty members, researchers, and dear participants. I hope you all had a refreshing and enjoyable lunch. We are now entering the heart of today's scientific deliberation, technical session 1. This session brings together some of the finest minds in veterinary and animal sciences who will be sharing cutting edge research, clinical innovations, and practical insights. To ensure we stay on schedule, I humbly request all speakers to strictly adhere to their allotted time. We will have a disciplined session so that every speaker gets due respect and the audience can benefit fully. Without further delay, let us begin. It is my distinct honor to invite Dr. Sumit Singhal, Professor, Veterinary Gynecology and Obstetrics, Bihar Animal Science University, Patna, to deliver the opening keynote address on recent trends in advanced technologies in optimizing bovine reproduction, challenges, and prospects. He has acted as chair and co chair in many scientific, national, and international conferences, and he has also served as associate editor and reviewer in high impact national and international journals, including BMC Veterinary Research, Scientific Reports, Journal of Advances in Biology and Biotechnology, Indian Journal of Animal Research, BMC Pregnancy and Childbirth, and many others. His scientific achievements was appreciated by Honorable Governor Bihar. Being an animal lover and eager to help livestock farmer, Dr. Singhal has delivered around 100 extension lectures to farmers, organized 20 training programs as course director, organizing secretary, coordinator, delivered few TV and radio talks, authored over 30 popular articles, and developed 10 pamphlets in local language for farmer community. A distinguished reproductive biologist and expert in assisted reproduction technologies, Dr. Singhal completed his BVSc and AH from NDUAT Ayodhya with a university merit scholarship throughout 5 years. He pursued his MVSc and PhD with ICAR, JRF, and SRF fellowship. He is credited as a key member of the pioneering team that achieved India's first OPU IVF pregnancy in Buffalo 2006 and produced the country's first OPU IVF live buffalo calf Saubhagya in 2008. With rich experience from Gadwasu, Ludhiana, and CAU Pusa, he has made outstanding contributions in embryo transfer technology, semen biology, and establishing advanced OPU, IVF, and ET. He has published 60 research papers, authored books and chapters, presented in numerous national and international conferences, and received several accolades, including Young Scientist Awards, Distinguished Scientist Award, and nominations for international recognitions like the Royan International Research Award. Dr. Singhal, the stage is all yours.
Thank you, Neha. Am I audible there?
Yes, sir, you are audible.
Very good afternoon to all the audience, the dear participants in this August gathering. I am thankful to the organizing committee members for providing such an excellent platform to share my views on the topic, that is recent trends and advanced technology in optimizing bovine reproduction, which is a challenging issue for the farmer community that are mainly the livestock owner producing the milk as their source of income. So as today we know that until unless the animal, the cow, buffalo, we talk for the animal producing the milk, mainly the cattle and buffalo. Although India being #1 in the milk production, as in the morning session, dignitaries, esteemed guests have said that yet we need to improve the productivity. Also, I would like to emphasize that not only the milk production is increased, on the other hand, the production in terms of animal infertility is also increased with the advancement in the milk production. And major cause of this infertility is the repeat breeding. So that the farmer is facing this challenge, and it is also suffering the major loss. Farmer is getting the major loss due to the rearing of the infertile animal. With this background, let me start. Are the slides moving with me?
Yes, sir, they are visible with you.
Okay, the slides are also moving with me, na?
Yes, sir.
Thank you, thank you. So this is the outline for my topic. Uh, with the introduction, for those that repeat breeding, we know that it is an animal, female animal that has failed to conceive with the fertile semen by three or more regular AI. Consecutive AIs has been done on an animal having no visible, clinically visible abnormalities in terms of the estrus, in terms of the discharge that is showing. And yet the animal is fertile from outside, but having the problem to conceive. Such an animal is called repeat breeding, and this is major cause for the infertility nowadays. An infertile animal to the research, to the major scientists, they say that when animal is unable to produce the calf in a year, because we all know that एक साल में एक बच्चा a calf in a year from a cow, then only the farmer can be in the profitable entrepreneur of this dairy industry. So two major problems that are anisters and the repeat breeding that are causing the economical loss to the farmers. In terms, if we talk that average milk production of an exotic cow is 11 kg of the crossbred in India, most of the nowadays farmers are rearing the crossbred cattle. They are on an average are producing 8 to 9 kg. And if we think the per kg cost of this milk is around 40, so we can calculate around 300 to 400 rupees per day is the loss of not producing the milk. Above that, the cost of rearing is cost of management. All those costs, labor costs are also involved. So directly cost on the milk, loss of the milk production is there. And if we talk for the buffalo, having the price, fetching the more price like 60 rupees per kg and producing on an average of 6 rupees, so 400 to 500 rupees per day loss to a single farmer for rearing a single such infertile animal is there. So what are the major reasons we should rule out this? This is the biggest problem nowadays. Earlier, we thought that repeat breeding is mainly due to the fertilization failure or the allometric mortality. Major cause, what we thought was the fertilization failure, but with the advancement in the research, particularly as Neha has introduced me, I am working in the in vitro fertilization. So in my lab also, I have seen the fertilization rate under the in vitro condition for the cattle of a flow site. It is about 80%. It is marvelous, 80 to 90% fertilization rate is there. But we all know that the carving rate, but is end means 3, 4, 5 from the 10. So where that loss is there, when 90% is getting the conceived, but only the 40%, 30% are giving the calf birth to the offspring. So this is the major challenge. That this is the major crux of this today's keynote address. 40 to 50% loss in between is there after the fertilization to the success production of the calf. This is only and only due to the mainly early embryonic mortality. What the early embryonic mortality is, we can see in this red circle, animal once fertilization is there, zygote is formed, and after different stages, cleavage stages, the 7th day, it is a blastocyst formation is there. When there is failure from the zygote to blastocyst formation, it is called very early embryonic mortality, which is causing around 28.4% of the fertilization, you can say early embryonic mortalities. From the 7th, 8th days, that is a blastocyst formation, to the MRP. What the MRP is? Maternal recognition of pregnancy. When an animal gets the signals, chemical signal, in terms that she is pregnant now. This is called the maternal recognition of the pregnancy. And if from the blastocyst stage, in between MRP, the loss of that is embryo is there. It is called the early embryonic mortality, and this is the major loss. You can see it is around 30 to 40%. Together, if we talk together, these are causing around the 50% of the, you can say, fetal losses. This is called the early embryonic mortality. Why it is called early embryonic mortality? Because in this, when this fetus get lost or the embryo get lost, the heat cycle, the cycle that is of 21 days, in the estrus interval is of 21 days, it is not extended. And it is the definition of the repeat breeding also, that cycle length is not altered. Signs of estrus are all proper, and animal is not able to get conceived, and we are not able to get rule out. This is the major reason, that is the early embryonic mortality. Other fetal losses are there, but we will focus on this part only. Now you can see the development stages up to the MRP, cleavage 1, cleavage 2, followed by the medulla, blastocyst hatching. Then on 15 day, we see that blastocyst transformation is there, elongation is there. You can see from 14 day and the 16 day, the difference is there from 6 mm to 60 mm. It is 10 times elongation of the blastocyst autofactoderm is there. This is mainly causing the expansion in the uterus and releasing some of the hormones, particularly the interferon toe. That is making an animal to give the signal that she is pregnant and escaping the release of those hormones that are making the repetition of the cycle. What are those hormones? If animal is not pregnant, concentration of the oxytocin receptors get increased in the uterine endometrium, which is going to release the prostaglandins, and these prostaglandins cause the lysis of the corpus luteum, that is the body that is secreting the progesterone. And if the fetus is there, healthy fetus is there, secreting the sufficient amount of the interferon toe, it will cause the not release of this, you can say, the prostaglandin from the uterine endometrium. So, with a brief of this hormonal control or what are the mechanisms of the estrous cycle, we know that in cattle, the estrous cycle length is from 0 to 20 days, means estrous interval is 20 days, defined by two, you can say, blasts, like two ovulation in the star form. In between two ovulation, we can say the estrous cycle is there. Hormone that is causing the ovulation is LH. Before that, the signs of the estrus are there. Immediately after the release of the LH, there is ovulation, and after the ovulation, there is formation of the corpus luteum. You can see here this yellow line. This corpus luteum get increased in size, and it is releasing the hormone progesterone. This is what the brief mechanism I am giving here. And in between these three waves are the follicular waves. The development of the follicles are there in between the one estrous cycle to another estrous cycle is also there. But ovulation only happens when the progesterone level gets down and when the LS is there, so it will lead to the ovulation. This is the mechanism. It will help us to understand what are the mechanisms in controlling the repeat breeding problem. Coming to the risk factors, what are the major risk factors causing this repeat breeding condition? Species and breed. You can say parity, salinity, fetal purity, milk yield, and breeding methods, and all these are the different risk factors. If it talk about the breeds that particularly if we talk about the buffalo that are sensitive to the, you can say, the heat stress also. So buffalo is having the high risk for the repeating conditions and parity. When the animal get the more and more pairs, means 3-4 calves has been delivered by the animal, that uterus becomes certainly some unhealthy, and chances of the repeat breeding are there. Means heifer that has not yet calved, the conception rates are more in compared to the animal that has calved 4 or 5 calves earlier. Fetal purity, more than above the fetus is more than above the embryos, particularly in case of the sow and in case of the dogs, when they are giving the multiple fetuses. So in case of the sow, means the pigs, more than above the embryos are there is overcrowding and can lead to the early embryonic mortality. Milk yield is inversely proportional to the more the milk yield is there, you can say the more is the it is directly proportional. More is the early embryonic mortality. So it is milk yield and the reproduction go inverse. So breeding method, normal breeding method, that is by mating, natural mating, it is causing the less repeat breeding condition in comparison to the AI. Although AI is also getting the good result, but if we talk many times, it is proper saying that if the animal not gets conceived with the artificial insemination, we can go with the insemination with the chilled semen or with the natural mating also. Seasonality, we have discussed that in the hot and humid season, the repeat breeding condition get increased. The BCS energy level will also affect the repeat breeding condition. Now, causes, and coming to the causes, genetic causes, it causes about 20% of the early embryonic mortality and the fetal mortality. Among those, gross chromosomal abnormality causing about 5% of the embryonic death. Among them, the major cause of the robertsonian translocation in animal, it is the you can say the exchange of the chromosome between the 1 and 29 chromosome that is causing the is found to be the reason for the repeat breeding and early embryonic mortality. Certainly, the aneuploidy conditions, polyploidy conditions like triploidy, polyspermy, polygyny, all these are responsible for the factors, absence of this deficiency of uridine monophosphate synthetase, an enzyme that is helping for the conception. It is due to the autosomal recessive disorder causing the repeat breeding condition at an age of causing the death of the fetus at 40 days. Complex vertebral malformation and certain genes that are responsible for the healthy cumulus oocytes, cumulus oophorus, if they are absent, they will or the improper switching on of the improper protein synthesis of those genes are there, they will cause the improper oocyte maturation. Fertilization rate will decrease response to the estrogen, and leading to the ovulation defects. Now coming to the endocrine dysfunctions, what are the major endocrine dysfunctions? Hormonal reasons for this breastfeeding. Subdue level of this LH. LH, as we have discussed, it is a major hormone that is causing the ovulation, healthy ova formation, and the ovulation, timely ovulation. It is a major function of the LH hormone. If it is insufficient LH is there, incorrect timing of the LH synthesis is there, it will lead to the delayed ovulation, aging of the ova, unhealthy ova that may fertilize and lead to the early embryonic, or that may also lead to the failure of fertilization. If fertilized, the developing zygote will not be the healthy. Both together will cause the early embryonic mortality. Estrogen is that hormone that helps the animal to express the signs of the estrogen, that helps the signs of estrus to be get expressed. But if it is estrogen level is again higher in case of the after ovulation due to the some another follicle that is causing the asynchrony between the developing embryo and the uterine environment. Because when after the ovulation, there is synthesis of the corpus luteum and progesterone get released, and it makes the receptors changes in the uterine endometrium. But if estrogen level is there, that nidation, that preparation of the uterine bed will not be proper. Anti-Mullerian hormone. AMH is nowadays is a very upcoming promising hormone. The concentration of this hormone doesn't changes with the physiological state. It reflects the reproductive healthiness of an animal. This hormone has been significantly utilized in human beings to find the AMH level and what are the chances for the pregnancy, particularly in case of the test tube babies, IVF conditions. Nowadays, in animal also, this hormone is being utilized to find which animal is having the better conception rate, which may be useful for the further assisted reproductive techniques. So higher AMH is good for the healthy mole conception rate. Low AMH is responsible for the repeat breeding conditions. Opioids, certain opioids obviously get secreted when an animal is under the stress condition. For example, beta endorphins and reactive oxygen species. Release of these things cause the impairment in the CL functioning. So when the CL function is impaired, it will lead to the early embryonic mortality. Luteal phase dysfunction. This term has been mostly used in case of human, but nowadays the similar term is being also used in the domesticated animals. It includes the inadequate luteal development, delay rise, or early fall, or short luteal phase, or premature regression of the CL. All these cause the downfall in the progesterone receptors, and as well as the downfall in the conception rate or the early embryonic mortality. Certain immunological factors, we know that as that animal get pregnant, the interferon toe cause the certain level of the low, decrease the level of the immunity, so that this foreign body that the developing embryo get implanted. But if there is certain immunological disorders are there, fine tuning between the embryo and the immunological system of the dam, so-called the mother, is not synchronized. It will lead to the failure of the implantation. If even the fertilization is there, implantation will not get succeed. Subclinical endometritis. This is a hot and burning issue now. Many research are there. Subclinical endometritis means clinically we cannot find out the endometritis. Clinically, we cannot rule out the metritis means the inflammation in the uterus. Clinically, we cannot see the uterus is unhealthy by even with the ultrasound also. So subclinical endometritis can be is a major reasons, again one of the good reason in causing the repeat breeding condition, particularly in case of the buffalo. If we see that if prevalence of subclinical endometritis is there, it will increase the chance of the repeat breeding in Among the three breeding, one may be due to the subclinical dermatitis, particularly in case of the buffaloes. What it does, it increases the cytotoxic effect and increase the MUC1. MUC is a type of the glycoprotein that is being that makes the, you can say, the receptors of the uterus. If the concentration of this MUC1 is increased, it will not allow the developing embryo to get implant in the uterine endometrium, to get nidition in the endometrium. These are the certain viruses, bacteria, and the protozoans that are causing the subclinical endometritis. There are a number of these infectious agents. Nutritional causes a negative energy balance. Certainly, overnutrition as well as undernutrition. It disrupts the pituitary hypothalamus pituitary gonadal axis and ultimately impairs the hormonal function, oocyte development, and the fertilization failure, or even the uterus receptivity for the developing embryo. Negative energy balance may be due to the any deficiency or absorption of the nutrition release, causing the release of the certain ketone bodies, and it will reduce the interferon tone, and it will not allow the mother to recognize the signal of the developing fetus, and animal will become the repeat breeder. So low IGF level, low nutrition means low IGF level. How it affects? It affects all the level, hypothalamus pituitary gonadal axis. This is the hypothalamus pituitary gonadal axis. It affects all the level. At the hypothalamus, GnRH secretion is less, gonadotropin releasing hormone. What it affects? It will then cause the less release of the LH and FSH. LH is luteinizing hormone, FSH is follicle stimulating hormone. Both these hormones are responsible for the proper development of the oocytes, follicles over the ovaries, and direct effect of the IGF is also there. Low IGF will cause the less secretions of the FSH and steroidogenesis, aromatase activity is less, and luteal synthesis, luteal tissue form will be of smaller size, or low luteal efficiency is there. At the embryo level, it will cause the low interferon production, and the growth of the embryo is also low. So it will all these together, these are the factors that will cause the poor fertilization rates or repeat breedings. Management causes are there. We have in the past 60 years, good study has been done by the Dobson and co-workers. What they found that in the 60 years, the chances of the standing heat are reduced. The animal showing the typical signs of the estrus that are reduced from 80% to 50%. And thus, as well as the duration of the estrus is also reduced from 15 hours to 5 hours only. And thus, it increases the chances of the fertilization failure. So 30 to 40%, because of the 30 to 40% estrus get unnoticed. What other reasons may be there? If it is, you can say, apart from these reasons, the management reasons, major management reasons that are more in the field condition, like precise coordination between the estrus and the AI, timing of the artificial insemination. Proper thawing should be there, and thawing at ambient temperature. Many times in the field condition, we check the temperature by our fingers only. This is again is a major reasons for the you can say the fertilization failure or the improper thawing of the semen is there. Inaccurate site of the deposition. Proper site of the semen deposition is the internal os of the uterus, internal os of the cervix, you can say. So it is a proper site for the deposition, and this, if inaccurate site of deposition is there, this critically decline the results in case of the artificial insemination, particularly with this sex-sorted semen. Then poor hygiene, even they don't, at the field level, we even don't use the cotton tissue papers to wipe the area part, and we do the AI that again will interfere with the conception rate and uterine environment. All these increase the, you can say, the embryonic mortality. Okay, another reason that if we increase the herd size, so depict of the estrus lines are better, but accuracy for the estrus detection is reduced because the herd persons, we have to increase the number of the herd persons so accuracy of the heat detection could be proper, so timing of the AI could be proper. Although some novel AI tools, different, you can say the software are also there, we will discuss later on. Now, environmental causes. Thermoneutral zone for the cattle, if THI increases up the 70-80%, if THI increases above the 70 and 80%, that will cause the increase in the prolactin release and decrease the LH hormone and the progesterone hormone. Thus, it is affecting the conception rate as well as the secretion on interferon toe. Heat stress increase the reactive oxygen species or reactive nitrogen species also at the cellular level, at the mitochondrial level, damaging the oocytes, embryos, decreasing the interferon toe, developmental delays, and embryologic mortalities. But the heat stress is having the effects on animal. It is having the direct as well as the indirect effect. Direct effect on the GRH and LH is there. Indirect effect on the uterine environment is there. It impairs the follicular development. It impairs the expression signs of the estrus because level of the estrogen hormone is low. When follicle development is poor, oocyte quality will be poor, developed embryo will be poor. All these are due to the heat stress. Animal will be in the negative energy balance. Both together will lead to the failures of the fertilization, failure of the uterus to be healthy, failure of the signaling, poor signaling due to the interferon dose, and poor nidation of the uterus. Together, these are the reasons. Some less causes, miscellaneous causes like the mycotoxins, agriculture chemicals, DET sprays, and stress mediated. Again, these are the reasons. Coming to the diagnosis of this, what are the tools along with the latest tools for the diagnosis of this repeat breeding condition? How we can know exactly the fertilization failure, the early mortality is the reason for this. Can say repeat breeding. Plant slaughter inspection of the post AI after timing, exact timing. You can say after 10 days, 12 days, we do the slaughtering of the animal and we can find whether the conception rate is there, whether the fertilization was there or not. And we can make the groups. Either the fertilization failure is a reason for the repeat breeding, either the aluminic mortality is reason, although this slaughtering it could not be possible under the Indian conditions to find out the exact root of the repeat breeding or the aluminic mortality. Retrograde flushing of the, you can say, the early developing fetus or early developing embryo inside the from the uterus can be a method to find whether the early embryonic mortality or the fertilization failure is a reason for the repeat breeding in animal. Daily, we can have some other reasons, some measurement of the certain biomarkers like the progesterone. If we check the progesterone daily on daily basis, if it is found to be, you can say, less than 1.98 on day 18 of the estrus, the chances for the aluminic mortality is there. And if it is more at the suprabasal at the day 0, means on the day of the estrus, the major hormone is the estrogen. But if progesterone level is more due to dysfunctioning of the luteal function, if progesterone level is above 1, say we can say above 1 or above 0.95, chances for the repeat breeding, chances for the aluminic mortality is there. But as well as on the other hand, after 10 day, after 15 day, progesterone is the supporting hormone. It is a pregnancy hormone to sustain the pregnancy. If it is less than 2 or 1.98 on day 18, it will certainly lead to the aluminic mortality. Some other factors, early pregnancy factor is now has been a emerging factor that can be checked. That if early pregnancy factor is there, presence of the early pregnancy factor that is very specific, secreted from the conceptus. If conceptus is there, so early pregnancy factor is there. So on day 3 day post AI, we can check this hormone, and up to 7 years, as soon as the embryo get died, this factor get lost. So this is a good biomarker. Okay, coming to the diagnosis part. After this, I have been told to conclude this. Coming to the conclusion part, early embryonic mortality is a critical barrier to reproduction success in bovine, leading to reduced fertility. It extends the calving interval and causing a major economic loss, particularly in case of the high-producing dairy animals. Because this early embryonic mortality, as we discussed, is having the multifactorial causes. Diagnosis on basis of single line is definitely not be a sure diagnosis. So we have to go with the multi-directional approach, and each individual case can be of different etiology, can be having the different etiology than the other, having the same repeat breeding conditions, same embryonic mortality. Targeting only the fertilization failure that we do earlier is not how we can optimize the reproduction. The better is to improve the uterine environment so we can achieve the pregnancy, because fertilization failure is not a reason for the early mortality, but in improper uterine environment is the major reason. Asynchrony between the embryo and the uterine environment is the reason. So with this, the future directions, we can develop some precise biomarkers like EPF, PAF, PAG. Nowadays, kits are available that can rule out the pregnancy. We can take the serum, look the serum, just like the card test in human beings. The kits are there, having the efficiency from 80 to 90%, 95% to check the pregnancy, depending on the days. After how many days of the AI or how many days of the pregnancy is there, that sample is being checked. Certainly, real-time reproductive monitoring using the automatic estrus detection AI tools also there that will overcome the insemination error, as we have discussed previously. We have been at many platform persons, scientists have been talking with the MOID, multiple evolution embryo transfer, OPU, IVF, ETT, and cloning. These are certainly to improve the reproduction, but for the herd that is having the elite animals that are very extraordinary animals in performance of the milk production. But for the farmers on a routine basis, these techniques would not replace the AI certainly. So are these techniques optimizing the reproduction, in particularly in case of the Indian condition, is yet to be explored because of the huge data is lacking here. Thank you. With this, I conclude. I thanks to the organizing committee members for providing me the platform to interact with this in this conference. Thank you all. Thank you, Neha.
Thank you very much, sir, for this illuminating, insightful, and comprehensive keynote address. Your profound expertise on advanced reproductive technologies and practical perspectives on bovine reproduction have set the perfect tone for today's technical session and greatly benefited all the delegates. Our next distinguished speaker is Dr. Samit Kumar Nandi, ICAR National Professor, Department of Veterinary Surgery and Radiology, West Bengal University of Animal and Fishery Sciences, Kolkata. A renowned veterinarian surgeon, radiologist, and leading expert in biomaterials, Dr. Nandi has made pioneering contributions in the field of tissue engineering, bone and cartilage regeneration, and advanced wound healing technologies. He holds a BVSc, an AH, and MVSc from Bindhan Chandra Krishi Vishwavidyalaya, a PhD from WBUAFS, and has completed postdoctoral research at Washington State University, USA. He is a recipient of several prestigious accolades, including the Rafi Ahmed Kirwari Award for Outstanding Research in Agricultural Sciences 2021, DBT National Bioscience Award for Career Development 2008, DBT Tata Innovation Fellowship, Biotech Product and Process Development Award 2013, and many more. With over 90 research publications, multiple books, including the textbook on veterinary surgery and radiology, and extensive work on waste derived and bioactive biomaterials, Dr. Nandi's research beautifully bridges sustainability and clinical application. Please join me in welcoming Dr. Samit Kumar Nandi with a warm round of applause. Thank you, sir.
So, thank you, Neha. Good afternoon. Am I audible?
Yes, sir, you're audible.
So, my presentation is on turning trash into therapy, waste data biomaterials from in wound healing. So, as you know, the tissue engineering is a very vital thing nowadays for repairing of the skin, cartilage, blood vessels, bone, muscles, nerves, kidney, etc. And there are large problems in the human as well as in these animals also. That is, in burn injuries, there is a secondary invasion of these multi-drug resistance bacteria, ultimately leading to septicemia, some diabetes problems. So in all the cases, it has been observed that the healing pattern is delayed with the conventional treatment strategies, and there is the cost involvement for these cases is also very increasing day by day. So commonly used materials and approach. Mostly these in the market, there is some hydrocolloids, alginate hydrogels based dressings, copper doped borate bioactive plus microfibers, and some animal origin and decellularized stabilized tissues are used. But the problem is this, there is the poor healing rates averaging 12 to 20 weeks in clinical trials, costly treatment appears, and the angiogenesis and the antibacterial efficacy is less or minimum and low bioactivity. And that's why the prior knowledge here is to need to develop some safe, biocompatible and affordable material-based strategies that can heal this situation in a better way and within a very low time or reduced time and also in an affordable cost. So the biomaterials which I worked during the last 3 decades based on these silk-based biomaterials in collaboration with IIT Guwahati, biological waste, derived fish skin and egg cell membrane in diabetic and barnum healing, bioactive gel and spray-based formulation in excision and barnum healing, marine-based collagen, aloe vera-based hydrogel, and waste-derived material from this grapeseed. And another one is the waste animal cartilage for plastic surgery in human patients. So this is the Ruhu piece, mostly this piece. Sometimes this piece, mostly Ruhu and this Bhetki piece that are used in West Bengal in some all parts of this country. And so the skin portion sometimes it is discarded because of this for the preparation of this fillet in the ceremonial purposes, and that waste material is discarded into land. Ultimately, it causes some land pollution. So we have collected and we have just converted this waste material skin, and we have developed some electrospinning mat from this fish collagen in collaboration in connection with copper and cobalt bioactive plus, and an electrospinning mat. That mat has been trialed in this animal model in excisional skin wound model and this barn wound model with a very good efficacy. So another work that is this is the Ruhu fish collagen, that is a material preparation, and we have confirmed in this in vitro testing through FDA, and this that is MTT assay, and the detailed characterization were conducted. And after that, this material that is mat, the electrospinning mat that has been used for this in vitro and the in vivo testing that has been carried out, that is the XRD and this scanning microscopy has been carried out. And if you just see here, there is this in a animal model of wound healing, there is a nearly scarless healing within 21 days after treatment. And and we have also published this work in ACS Biomaterial Science and Engineering, a leading journal of this American Chemical Society of 5.5 impact factor, and journal of this mechanical behavior of these biomedical materials. And later on, after animal, that is in lab animal models, we have trial in our hospitals in a wound, in a canine models, and with some good efficacy in this material. So another that is this modified fish collagen sponge, jellyfish collagen, and PCL-based composite electrospinning mats for wound healing purpose. And these are mostly this sponge jellyfish collagen, that is this marine waste, and after fishing that has been thrown to this ground, and ultimately it causes some lead pollution. And we have taken in collaboration with this NIO, that is National Institute of Oceanography, Goa, and this Central Glass and Ceramic Research Institute, we have developed some electrospinning mat, and we have tried before going for this animal application. We have seen the different hemocompatibility assays and the different in vitro tests to cell proliferation assay, that is FTT, and the FDA assays. And later on, we have shifted for this animal model testing. And in the majority of cases, within a certain period of time, the healing pattern is very, very aggressive. And we got some good remarkable result within 21 days after application. So it is an enabled hybrid aloe vera based hydrogel for the treatment of critical wounds. As you know, the aloe vera is having a good angiogenesis properties, and we have developed some gel-based product, and we have trialed in this animal model. And before going for this in vivo model, we have trialed in this in vitro model through FDA assay and this MTT assay, and hemolysis study also that this material is very safe, biocompatible, and that can be safely used for this wound healing purposes, and this healing rate is quicker as compared to these conventional material that are available in this market. So it is another product we have developed, and we have already submitted one patent from this grapeseed. It is a veterinary waster. There is a grapeseed waste. It contains a severe amount of this proanthocyanidin, and this proanthocyanidins play a very critical role in this wound healing. And we have carried out several in vitro testing, including the antioxidant assays, scratch assays, and through different in vitro testing, we have applied in this animal model, and we have found that this material, this gel-based product, is having a very good utility in this wound healing after animal application. And now that material is under this clinical application, this human patient in the surgical medical college in our near surrounding to our university, in collaboration with this plastic surgeon of this Kolkata. So this is another work we have carried out in a PhD work of my student. So as you know, the Hindus, for these pujas, that is two flowers are mainly used. One is this hibiscus, another is this marigold flower. So after pujas, that flowers are generally thrown to this water, and ultimately it falls to this water pollution. In the village areas, if you just see, they will thrown into this pond. So the problem that is a problem for this fish also. There is a disturbance of the floral content of this pond, and also in this river. In our Kolkata city, if you just see in this Howrah, nearby Howrah Ganges, the flowers are thrown to this Ganges, and ultimately it causes the land pollution. So we have collected these carbon dots from this flower, and that carbon dot has been trapped within this gel and this spray, and we have trial in this animal model, and we found that this healing pattern there is a scarlet healing, and we have also this product is also we have already submitted one Indian patent that is under in process stage, and we have also carried out this work in this human patients in human clinical application in this surgical medical college also. So this work, these several works we have carried out in collaboration with this IIT Guwahati. The silk-based biomaterials, particularly for this wound healing, different varieties of silk, either Muga, Seri, Anthera, Sarma, and the waste material has been that is protein part we will take, and after that we have developed some gel-based product, nanofibers mats, and dressing material, and we have found that this material is a very good effective material for this wound healing purpose in this animal model, and hopefully we will go in future for this clinical application with this material. So another work that has been published in a very good journals also this work, and we have also developed some in collaboration that was a DBT funded project, a silk-based vascular grafts. As you know, for this in human for this cardiac surgery or bypass surgery, that is we have to take another vessels from this same patient, and so it causes some morbidity. So we have developed in collaboration with this IIT Guwahati, that is a silk-based small diameter vascular graft, and that graft has been applied in this anastomos in this jugular vein of this rabbit model, and later on, you just see some videos where there is a connection. There is a flow of this blood, and you see this Doppler machine effect. That is a complete, that is flow of this blood, and there may be alternative sources for this in future for this human application. So another work in the completion of this stage, we are working on a silk-based biomaterial, and as you know, in this canine, that is a mammary tumor is a common problem, and in canine model, this mammary tumor, there is a local delivery systems with these doxorubicin drugs that are very suitable drugs, and that can be targeted through this local delivery instead of radical surgery in a bigger way. So we are hopeful, and the results or the outcome so far we have obtained, that is in a very good stage. So another is this egg cell membrane, that is that is this egg used for this omelette or this boiled egg. So this outer covering is generally discarded. So we have collected this egg cell membrane. The inside there is a thin membrane that is a rich source of collagen, and that can be used as a very distinct material for this milling. And we have carried out this work in a very and published two articles. And this material, that is this ESM, that is XL membrane, that has been coated with bioactive glass with some metallic ions for better wound healing purposes. And we have trial in burn wound healing and this diabetic wound healing also. So these are the different another works, that is from this Betke fish collagen bioactive glass material, fish collagen from this for wound dressing purpose, for burn wound dressing purpose. So that is a number of research papers we have published from that works, from this our project work, and also from this different masters and this PhD's work. So another that is a work we have developed with some nanospray bandage, particularly for these ischemic wounds, where these blood supply to these areas is hampered. So we have developed and we have found that this product is a very good product, and we have published this work in a good journals of international journals of more than 80 factors. And biogenic polymeric patches we have also developed, and we have already worked with this material and having a good, very wound healing properties. So this was a work. It was previously work done, and that is a acellular conchal cartilage. As you know, in case of this human, there is a microtia of the rhinoplasty, that is some defect in his ear and his nose. That is a problem. So the commonly material that are available in this market that cause some immunogenical reaction. So synthetic material is having, after a certain period of time, there may be a rejection. And to avoid that thing, we have developed very affordable material from this waste animal conchal cartilage. That is, after slaughter of this animal, this ear has been thrown to this ground. So we have taken that cartilage and we have made it acellular, and lots of in vitro testing in this laboratory we have carried out. Then we have gone for this animal model, and next finally we have carried out for reconstruction of this ear defect, that is called this microsia operation, and for this nose defect, that is the rhinoplasty operation in these human patients in collaboration with the Medical College. This is a DBT funded project. This was, and we have already granted one Indian patent from this work, and we have published two articles. Thus, you just see this is the cleft palate and this the defect in this nose, and after operation with this material, this is the situation. So if you just see, this human patient is having no ear or a very small ear, we have developed or reconstructed this ear. Here also you just see this reconstruction of this ear and this nose. There is this synergy of this, the facial loop that has been developed. So these are this work, that is all this work mostly we have derived from this waste derived material that has been thrown to this ground or this water and having no value, and we have converted this trash into this biomedical product. And some products we are hopeful, and we are in talking conversation with some companies to translate these medicines or translate this product for this large scale application in this animal and the human patient also. So I acknowledge in collaboration with different universities, the funding agencies, the institutes, and the vice chancellor of my university. So some the awards that I got during my tenure. Thank you all. Thank you all.
What an inspiring and innovative presentation. Thank you, Dr. Nandi, for this enlightening talk on turning trash into therapy, waste derived biomaterials in wound healing. Your,
Thank you.
your groundbreaking work on sustainable biomaterials and their transformative role in wound healing and tissue regeneration has beautifully shown us how sustainability and advanced therapy can go hand in hand. Your insights have greatly enriched all of us today. Thank you so much, sir.
Thank you.
Next, we have Dr. Shalaka Arvind Chauhan, Professor. Next, we have Dr. Shalaka Arvind Chauhan, Professor, Department of Veterinary Surgery and Radiology, Kranti Sen Nana Patil College of Veterinary Science, Shrival, Maharashtra Animal and Fishery Sciences University, Mafsu. A highly accomplished veterinary surgeon with expertise in soft tissue surgery, orthopedics, laparoscopy, and minimally invasive techniques. Dr. Chauhan holds MVSc, PhD, PGDAEM, and PGDAW degrees. She is actively involved in advanced clinical surgeries, hands-on training programs in endoscopy, and small animal procedures, and has published research papers in national and international journals. She has been elected as West Zone Secretary of the Indian Society for Veterinary Surgery, ISVS, and regularly delivers expert lectures and organizes skill development workshops for veterinary professionals and students. Her vast clinical experience and practical approach make her a perfect resource person for today's topic. A big round of applause for Dr. Shalaka Arvind Chauhan. Ma'am, you can start your screen share.
Just 1 second, please.
Ma'am, you can start.
One moment. Share the screen. See the screen. Can you see me?
Yes, ma'am, it is visible.
Can you see the change of slides?
Yes, ma'am.
Okay, thank you. Hello everyone and good afternoon. This is Dr. Shalaka Arvind Chauhan. I am professor in Department of Surgery and Radiology in Kranti Nana Patil College of Veterinary Science, Shirwar. First of all, I want to thank the organizers who have taken so much pain and have given me this opportunity to have a word of interaction and present my work to such great distinguished speakers and the delegates and the participants of this conference. Today, I will be dealing with a topic that is useful in small animal clinics and is a advanced skill over the surgery. So, minimal invasive techniques in veterinary medicine is our today's topic of discussion. Little about our university. Our university is situated in Nagpur and it has 6 constituent colleges right now and 2 more coming up. So I had a great privilege in working in 3 colleges out of the 6. So I've studied and worked in Mumbai Veterinary College. Then I worked in Nagpur Veterinary College, and now I'm at Kranti Nana Patil College of Veterinary Science. So whatever I'll be presenting is the work which is done in all the 3 colleges. And I'm really thankful to all the staff and the professors who have made me able today to present forth the laparoscopy skills that I have developed here. So we will be studying the various laparoscopy procedures as the time has been allotted just 15 minutes. So it is difficult to concise all the procedures that are being done through endoscopy. So I will be limiting myself to laparoscopic procedures. Yes, we need a laparoscopy setup with all the equipments and instruments for laparoscopy. And like any other surgery, we need the animal to be prepared for the procedure, and we should know how we can introduce the camera and the working ports according to the need of the laparoscopic procedures. So on your right side, you can see a variety of procedures that can be performed in the through the abdominal scopy. So laparoscopy actually means the endoscopic examination of the abdominal cavity. In 1806, Philip Bozzini, he actually evaluated the urinary bladder, and he gave through a very primitive scope, which was just a small pipe-like scope through which he could see. And slowly over the years, now over 2 to 3 decades, laparoscopy is developed very well in veterinary industry. It was a kind of a game changer in human medicine, and many procedures, many diagnostic procedures were done through laparoscopy. It is a safe, simple, and minimally invasive procedure, as it has very small incisions which allow the camera inside. There are very less chances of complications. So also we can actually visualize the organ from through the camera, and we can also conduct or take biopsies of the organs, which are normally difficult to reach through the conventional surgical methods or through any other modalities like USG. There is very low mortality rate because there are no big incisions, very few complications which normally arise in conventional surgeries like wound dehiscence and also infections in the very long incisions. So this also shortens the hospitalization period, and there is faster recovery, thus giving the improved clinical outcome with reduced pain sensation. So laparoscopy allows us diagnostic and ancillary diagnostic techniques, and it also helps us in interventional and therapeutic techniques in veterinary field. What we should not do, we should learn first. So it is contraindicated in poor and bad general condition. It is in high risk patients. Normally those patients who have increased clotting time or abnormal clotting or reduced platelet count, we should avoid laparoscopy in such patients. Then conditions like DH, pyometra, dropsy, peritonitis will obscure the vision in the case of laparoscopy. So these are few contraindications. Endoscopy generally can be done by various scopes, rigid scopes, semi-flexible scopes, and flexible scopes. So out of that, in laparoscopy, mostly rigid scopes are involved. Like I mentioned, a very specialized laparoscopy tower is needed for laparoscopy. The instrumentation, the cost involved in instrumentation is very high in this case, but once you start using it, the value it gives to the surgical outcome that this technique gives is really rewarding. So we need a display of monitor through which we can see. Then we need a CO2 insufflator that will create the space in the abdomen. We need a light source, a documentation recorder, a camera unit, a suction unit. These are the basic things, along with the laparoscopic instrument and accessories which are given on the right side. That is the Veress needle. Then laparoscopes from 2.7 to 10 mm, 0 or 30 degrees viewing angles with 2 trockers minimal, and various forceps and biopsy forceps. Traditional look of your workstation should be like this. The animal should be positioned in about say 30 to 45 degrees angle. It is called as Trendelenburg position or Fowler in by Fowler, and you can have the the trolley unit as per your surgical procedure. So placed as per your surgical procedure. So this particular animal is positioned for ovariosterectomy and ovariectomy, and you can have the accessories placed likewise. So these are the accessories. These accessories are mostly they are chemically sterilized or sterilized by gas, and now the newer accessories that are available that can even be autoclaved. Ergonomics are important part of laparoscopy training. So ergonomic integration and suitable laparoscopic operating room environment are essential to improve your efficiency. They just allow the safety and comfort of the surgery or operating team. The ergonomics can only make the life of surgeon comfortable, like mentioned in the right side. The recommended visual angle is 15 to 40 degrees below the eye line. Then manipulation angle should be 60. Manipulation angle is the angle between the two arms, and the azimuth angle should be around 30. So that is the angle between your camera and the working port. So this will help the surgeon, since laparoscopy differs from the open surgery in such a way. In open surgery, you can actually handle the organ that you are interested in. You can feel that organ and you can identify. But here, you are grasping the organ with the extended arm that is with these accessories. So the surgeon needs to be comfortable. So patient preparation is equally important. We should run the thorough clinical examination, blood parameters, coagulation profile should be run, and all the other assessive diagnostic modalities are needed prior to this procedure. Fasting as usual for more than 12 hours, and the animal can be positioned in lateral or in dorsal recumbency. Then you must express the urinary bladder by that you will, and you should always be ready for the conventional laparotomy surgery if anything does not work out in the entire procedure. So you should always have the sets ready. Anesthetic protocol as per the suitability of the surgeon or the anesthetic team. These are few I'm explaining which we found good in terms of doing the pneumoperitoneal procedure. So aceclomazine gives better muscle relaxation, or the combination of metomidine, dexmetomidine and budoprutol as well. Induction is done by propofol, and the anesthesia is maintained by the inhalation anesthesia. Right lateral approach for gallbladder, pancreas, right kidney, adrenals are recommended, and ventral midline approach with or without Trendelenburg or anti-Trendelenburg position is needed for ovariosterectomy, OHE, and kidney pancreas. So this is a thumb rule. The thumb rule of right lateral approaches. If you draw a imaginary line, which is shown in red here, from the xiphoid to the wings of the iliac, the triangle that is formed between the just below this line and between the bladder. So the area between the spleen, kidney, and bladder is ideal for the right lateral approach, and you can reach the through this for liver biopsies and other biopsies. Whereas ventral approach can be taken just about 1 or 2 centimeters away from the midline at the level of umbilicus or little behind the umbilicus, as shown in the black circle here. So first step of doing laparoscopy is doing the Veress needle insertion. This is a blind insertion, so you can see this particular Veress needle. It has a door lock technique, and it has a sharp edge through which you can puncture the deeper layers of the abdomen, as shown in the picture here. So you should take a small nick of incision at the level of umbilicus or little away, which is shown in the first figure here. And with the Veress needle insertion, you can feel a knocking sound once it enters into the abdomen. Once it enters into the abdomen, you have to conduct a small test which is called as a hanging drop test, which is shown in the picture 2. So in this hanging drop test, you can put a few drops of NS. If they freely go inside, that means the needle is placed properly. If they are not drawn inside, that means the needle is placed subcutaneously, and you have to further ensure the placement of the needle properly into the abdomen. Once the needle is placed in the abdomen, you start the abdominal insufflation with CO2 at about 12 to 15 mm of Hg, and then once the pneumoperitoneum is achieved, it is a time to introduce the main port for insertion of the scope. Another method is Hazen's technique or open method technique. So here you can take a regular incision with the regular blade and incise all the deeper layers of the abdomen. Once it is attained, you can place the port as which is shown in picture in picture 3, and you can start the insufflation of CO2. You can create the pneumoperitoneum, and as shown in picture 4, you can place the camera inside. So once the camera is placed inside, you can see a illuminated spot with the camera. So that is where you can place the working port inside. Once inside the abdomen, you have a look of the entire abdomen, whether you have punctured any organ, especially spleen gets punctured with the newbies or with the new laparoscopic surgeons. That won't be that much of bleeding. It will stop automatically. It's just a small punch, but you can check all these things. You can check the entire abdomen for any other concurrent problem or issue, and then further you can address the area of interest. So basic abdominal examination you can go through. You can see the intestines, the uterus, which is shown below here, then the kidneys, then the bladder, and the liver and the diaphragm can be studied. Now is the time to place the working port. So working ports can be placed in linear fashion, or you can place it in the triangular fashion as shown here. The first time workers, normally they will practice through the triangular fashion, and as they improve or expertise, they go to linear fashion, and you can also do these things through double or single port itself. So various biopsies can be undertaken. As shown in the first video, liver biopsy is being taken with a gripper or biopsy forceps. So you place the biopsy forceps through the working port, place it under the liver lobe, and you let the liver lobe fall into the grasping forceps like this, or through the biopsy forceps like that, and you can grab the punch biopsy of this liver. The image that is shown is normally magnified, so don't worry about this bleeding, or you can also apply the hemocoagulating sponges that are available and have these liver biopsies done. The beauty of this technique is you can actually examine the entire liver, and you can take the biopsy from the proper site or from the proper lesion, which you can see through this camera, which normally is not possible in FNAC or ultrasonography guided biopsies. Similarly, in pancreas, you can see the pancreas, and you can go in for the pancreatic biopsy or with the help of the endoloop biopsy. So normally it is difficult to handle pancreas through conventional methods, but this assures you can also arrest the hemorrhage if at all in this case, and collect the quality biopsy. Similarly, kidney biopsies are lab-assisted biopsies. You can take it through the two-cut needle, and through the working port, you can introduce this probe, which you are seeing in the first video. So with this probe, you can select the site, and from the outside, now the surgeon will be introducing the true cut needle directly from the directly from the abdomen after placing the camera inside. So here a small incision is being taken and 2-cut needle is being introduced to take the biopsy of the kidney. So the probe is guiding the 2-cut needle, and once the biopsy is taken, through this probe you can apply the pressure on the place and stop the bleeding in this case. So like I mentioned earlier, coagulative gels are also available. Similarly, you can go for intestinal biopsy and the mesenteric biopsy. So these are the various biopsy you can take through this technique, which otherwise conventionally are difficult to perform. So insertion port, like I mentioned earlier, is a guided port. So you can guide it through the telescope that is being planted through the main port, and you can take small incision and apply the working port in the fashion. So this is the inside of the abdomen, and from the left side the working port is being introduced. So you can also see the working port being introduced. So likewise, in triangular fashion, you can perform laparoscopic ovarectomy, laparoscopic ovary hysterectomy. You can also do the cryptorchidectomy through laparoscopy. So here in ovarectomy, you grasp the uterus. You can see the blood supply to the ovary, and it is being cauterized. So here cautery technique is used. Newer techniques or newer vessel sealants are also available in the market. So vessel sealant are also very well useful in cauterizing such main blood supplies of organs like ovary. So here in picture 5, the ovary is being grasped. In the next picture, you can see the cautery is being applied, and in the next picture, once the cauterized part is cut to separate the ovary from the abdomen, and the ovary is removed from the working port. This is very much I explained earlier. So likewise, either you can remove the ovaries through the working port or directly from the abdominal incision. So on the last picture, you can see a scale is being kept that so a small scale is being kept around the incision. So you can see the incision is very small. It is even less than half a centimeter incision, and very few complications will be seen in such cases. So these are another single and 2-port techniques of same laparoscopic ovarectomy. You can also tie or transfix the ovary from the abdomen outside, like shown in this picture. Then another ways of ligature or endoloop applicators or clip applicators. So already the loop is being prepared and is passed through the working port around the ovary, and it is pulled, and then ovary is just cut like usual. So similarly, ovarectomy can also be performed. You have to ligate both the ovaries. You can cauterize them, like in picture 5 here, ovarian pedicle being cauterized and being resected in the next picture. Similarly, second ovary is being resected, and the body of the uterus is also being cauterized, and the entire uterus is removed from the same 1 centimeter and less than incision. This is how you and your assistant, with your coordination, you can grasp and ligate the ovary, and here it is being cut. So this is the cautery being applied. One minute, I'll show you. Yeah, this is the application of cautery, and then it is being cut. Okay, this is the scissor. So this is removal of the entire uterus. Similarly, for cryptorchidectomy, you can identify the remnant testes in the abdomen. You can cauterize the blood supply like this, and the testicle can be very comfortably removed. Otherwise, it is through conventional methods, it is a little bit of hassle to remove or to find these testicles and to remove them. Similarly, preventive gastropexy also is one of the in topic these days, as in large breeds, specifically of dogs, which are prone to gastric dilatation volvulus, and it is performed by exteriorizing the pyloric antrum region, just about 2 centimeters caudal to the last rib, and it is ligated by 20 viculae, or it is attached to the floor of the abdomen by 20 viculae. So you can do first and two those ligations. So there are many other techniques that can be implemented through laparoscopy. You can perform even spinal endoscopy in minimal invasive surgery. Minimal invasive surgery is also applied in orthopedic surgery. You can perform plating using minimal invasive techniques, and like I mentioned, that endoscopy can be also done in spinal surgery for IVDD cases. So here are some papers that we've published in reputed journals. We also have offered the course on basics of small animal laparoscopy. It is still available in www.research.in, and many people have been benefited during COVID through this course. So this course involves complete session recordings of the videos that were taken. It also enables you to know the instrumentation and the surgery, and everything is available in video format in this particular course that we offer. So to conclude, minimal laparoscopy is a minimal invasive technique for diagnosis and surgical procedures, causing reduced pain, faster recovery rate, and gives a positive clinical outcome. Surgeons need to adapt to this various equipments because there is reduced tactile sensation. Like I mentioned, that you are working with the extension of your arm. So you need to have training, you need to improve the hand-eye coordination, and that's why the learning curve in this technique is a bit steeper or is higher. But once you acquire the skill, it becomes very easy, and moreover, it is very much beneficial to our patients. This technique can also be implied or applied in large animals for various other procedures. So once the basic technique is mastered, it is very rewarding and very simple to do these procedures. So you can also do simulation practice in various things as we do in papaya using pumpkin, or there are simulators available which you can play like video games also. So to sum up, wider adoption of this veterinary practice will the equipment becomes more accessible. You have to be in one with the equipment, and the training is required because it is the advanced surgical skill that you need to. However, it is also it can work in integration with advanced imaging and also in case of robotics for better type of surgeries. So this is my team in Nagpur, which we worked in. And thank you so much. If any questions, please go ahead. Neha ma'am.
Thank you, ma'am, for this clinically rich, highly practical, and insightful lecture on minimally invasive techniques in veterinary medicine. Your presentation beautifully demonstrated the advancements in surgical procedures that are transforming veterinary practice, offering real world applications that will greatly benefit clinicians and researchers alike. Thank you so much, ma'am. It was great to have you right there.
Thank you so much.
Thank you, ma'am.
Thank you.
Moving ahead, we have another insightful guest lecturer, Dr. Supriya Shukla, Professor and Head Department of Veterinary Pathology, College of Veterinary Science and Animal Husbandry, Maho, Nanaji Deshmukh Veterinary Science University, Jabalpur. A highly respected veterinary pathologist with extensive expertise in disease diagnosis, toxicopathology, oncology, and infectious diseases of livestock and poultry. Dr. Shukla has made notable contributions in the field of veterinary pathology. She holds a MVSc and PhD degree and has guided several postgraduate students with a strong research portfolio. She has published numerous research papers in national and international journals and is widely cited over 650 citations on Google Scholar. She has successfully organized scientific events and workshops and is actively involved in advancing diagnostic pathology and understanding disease mechanism in animals. Her talk today on future perspective on cell death modalities and disease implications promises to offer deep scientific insights. Please welcome Dr. Supriya Shukla to this session. Thank you so much, ma'am.
Thank you, Neha. Thank you, Neha.
And thank you so much, ma'am.
So a very good afternoon, and it's going to be almost like evening now to all the audience. And the topic of my lecture is future perspectives on cell death modalities and disease implications. I know after having here you have seen and heard so many good practical veterinarians like Dr. Nandi and Nan just now, surgeons. This topic will be a little, you can say, subdued for you or may not hold that much interest for you. But I chose this topic because it has some diagnostic implications. So, in the pathology class, everyone must have learned about injuries, pathogenesis, and cell death. Now, from now on, and in future, we are dealing with different types of cell death modalities, especially after the corona pandemic, and the progression of the disease involving the different types of cell modalities. The progression of the disease with these, after having knowledge of these cell modalities, you can just map or tag the disease by different agents which are involved in the progression of the disease in between. So it's just not necrosis, it is many other types of deaths. And there are many markers in between which are being used in the medical science also. And there are clinical trials in the veterinary science also on these markers as the disease progresses. So the clinicians, the brilliant clinicians, as I just heard, they can just monitor the disease, give medicines at the right time, or they can do surgery or gynae practices on these patients and just they can just retard or the suffering of the animal or lower the suffering of the animal if the diagnostic markers can be used if they know about these modalities. So the basic is that cell death is the ultimate result of cell injury, and when the cell is exposed to different types of injurious agents, then a sequence of events follows that is loosely termed cell injury. To a certain point, it is reversible, and then it reaches a point of no return when the cell, about 75% of the cell components, they are damaged. So there is a point of no return, and the injury is known as irreversible cell injury. This is just a chart displaying the reversible cell injury and the irreversible cell injury. Next. So the causes are hypoxia, mainly hypoxia. It is seen in many clinical diseases also. Physical agents, then chemical agents and infectious agents, the viral agents, the bacterial agents, and the fungal agents, immunological reactions such as anaphylactic reactions, nutritional imbalances, and genetic defects. Much emphasis is being placed on nowadays on the nutritional imbalances, especially in the pet industry, and infectious agents. If the vaccine is there, good, okay. But if there is a change in the bacteria or the virus, then mutations are there, then we have to go for, and according to the area also, we have to go for new vaccines. This is just common biochemical mechanisms which are involved. After hypoxia, there is a lack of energy, ATP depletion, and the mitochondrial function fails, and entry of calcium in the cell at the cellular level, biochemical level. These changes are seen. Defects in the plasma membrane permeability and mitochondrial function, that is the cytochrome C, it leaks out of the mitochondria and enters the cytoplasm and starts a chain of reactions there. This is a diagram or a pic showing the different type of changes in the reversible and the irreversible injury. And under the microscope, especially the light microscope, you can see some of the changes, and the electron microscope, you can see these changes. The cell changes, there's a change in the contour of the cell. Membrane blebs are there, and myelin figures, which are just phospholipid debris, they can be seen under the electron microscopy. This is a damaged cell, and it shows irreversible cell injury. So the first part is the ischemic reperfusion injury or the free radical injury. Ischemia, ischemic reperfusion injury when there is lack of blood and oxygen in a certain part of the body, and then sudden flushing of blood in the adjacent part will lead to the reperfusion of that area. That also causes the free radical production. So these changes, that is on and off changes, okay? These they lead to the formation of reactive oxygen species, and most of the changes now we know in pathology, it's a it has the scientists they know that almost all types of injuries they culminate in the free radical induced cell injury. Okay, so this is the pic of a myocardial infarction. This is the area of necrosis where the arrow is there, the light gray. The free radicals, we all know it is being taught in the medical sciences also, and we every day we are being seeing on the net and everywhere. So peroxide, hydrogen peroxide, hydroxyl ions, singlet oxygen, nitric oxide, which is actually a friend of inflammation. And this it prevents inflammation to a certain degree, nitric oxide. This is the formation of free radicals. And how the free radicals, we get them from the UV light, we get them from air pollution, ionizing radiations, smoking in case of human beings, inflammation, and some metabolic disorders. And basically, the free radicals damage at many levels, but they at the highest level, they damage the DNA, and their number should be enough to damage the DNA. 4 or 5 free radicals will not damage the DNA. They have to be there in many hundreds. So these are the free radical generation. And these SOD, catalase, the glutathione peroxidase, these are the being used as for medical intervention or to treat the free radical injuries. One is the production, the other is the regulation of the free radical generation or neutralization of the free radical generation. So after the product, by this ischemia injury or the free radical injury, basically we come to the cell death. And in pathological terminology or pathological parlance, we call it necrosis. It is the local cell death characterized by swelling of the organelles inside the cytoplasm, rupture of plasma membrane or its lysis, and the intracellular contents spill into the surrounding tissue. And it is always pathological and includes more damage with inflammation. The mechanisms of necrosis are the basic, the low oxygen levels and low level of ATP generation. The anaerobic glycolysis starts because of that. And there is accumulation of lactic acid. Accumulation of lactic acid resulting into the clumping of chromatin, lysosomal detachment from the endoplasmic reticulum, and due to diminished mitochondrial function, the surface flaps and myelin figures are produced. This all is there as a part of the, you can see it under the electron microscope. The types of necrosis are coagulative, depending upon this is all grossly how you can see it, the patterns of necrosis. So whenever we do postmortems, we come across these patterns. First is the coagulative necrosis, when it looks like a cooked appearance of the organ. There is a change in the color of the organ. And internally, histopathologically, the architectural details are retained, but the nuclear features are lost, and there is pycnosis, karyorrhexis, and karyolysis of the nucleus. So this is histopathology of kidney. Liquefactive necrosis. There is, you can see it changes into both the architectural and the cellular details are lost. And there is a viscous mass necrotic material called pus. And this we can see this is brain of goat. And there is liquefactive necrosis with focal tissue separation. Caseous necrosis, TB, as the basic BBSC student knows, caseous means cheese-like and it refers to the white appearance of the necrotic area. This area is known as granuloma. This is the granuloma with the lymphocyte rim at the border and fibrous tissue, epithelioid cells and giant cells. Fat necrosis. This is because of the release of pancreatic enzymes and saponification of fat. So this was the basic necrosis grossly. And histopathologically, the different types of changes are seen in the cells or in the structures. Now, the other type of specialized cell death is apoptosis. It is a physiological, pathological process to die. It can be both physiological and it can be pathological. And this process helps to eliminate the unwanted cells by an internally programmed series of events affected by gene products. It is caspase dependent, and a caspase, a certain type of proteases, it is dependent on that. And the chain or the autocatalytic reaction is started by the caspases 8, 9, 10, and ultimately the cell is killed by the executor caspases 3, 6, 7. So physiological embryogenesis, there is death of cells, and in regression of the bursa or the thymus, there is depletion of the cytokines. So that is also physiological. Hormone dependent involution of the endometrium, cyclical changes in the ovary, breast. These are all a part of the physiological apoptosis. Pathological is removal of the damaged cells, especially viral infections. Around 20 years back, we associated apoptosis only with viral infections and cancer and with aging. So by virus, in case of this is in liver, council body, and to eliminate misfolded proteins, killing of tumor cells, and graft rejection. This is the mechanism of apoptosis. In this, there are no inflammatory changes outside because there is no release of the lysosomal enzymes outside. So no inflammatory changes and no debris outside. This is just, the part is phagocytosed. So these are the apoptotic bodies. There's degradation of the DNA, condensation of chromatin, and then several apoptotic bodies are they are cut out from the main cell. There is cellular fragmentation and there is phagocytosis of these bodies. There is an extrinsic pathway and the intrinsic pathway of apoptosis. That means this is an immunological pathway, extrinsic pathway. It is governed by the TNF mediator, tumor necrosis factor, and the FAST ligand. And it is also known as the death receptor, FAST ligand and TNF. And when these are activated, they are present on the this cell membrane. These are activated, and through these, there is then autocatalytic. With the help of the adapted protein fat, pro-caspases, which are turned into active caspase 8, then pro-execution caspases inactive, they are turned into the execution caspases active. And that these stop the mitochondrial function and there is cell death. The next is the intrinsic pathway or the mitochondrial pathway. There is increase in the mitochondrial permeability. The cytochrome enzyme C leaks out and it combines with FF1. And after this, the caspase cycle starts or the cascade starts. So this is the protein. This part is where we can go for it as a diagnostic marker. Then there is a balance between the pro-apoptotic and the anti-apoptotic enzymes or proteases. So the pro-apoptotic are these glucocorticoids. Anti-apoptotic are the BCL, XL, and several viral proteins. So when the pro-apoptotic markers, they take a upper hand over the anti-apoptotic markers, the pathway is regulated. The other form of the cell digests itself, in short. So induction is by activation of signaling molecules such as protein kinase complex and the mammalian target of rapamycin. Again, mTOR is being used as a marker for disease. The mechanism is it can be internal or external. This is autophagy. So these you can see snare-like proteins, they combined with the phagosome and lysosomal snare-like proteins, and they release the lysosomal enzymes in the phagosome, and there is fusion of lysosome with autophagosome, and the and the part which has to be lysed, that is degenerated in the autophagolysosome. So this can be autophagy can be macro or it can be micro, which is endocytosis, or it can be chaperone mediated. Again, this chaperone mediated autophagy is where we can, as a clinician, we can take some help for the progression of the disease. So the outer one, macro autophagy, the micro autophagy, and the chaperone mediated, heat shock proteins mediated, HSC 70 chaperone. Okay. So this is the motif, KFERQ, 5 amino acid motif, and this can be mapped for different types of diseases and for the progression of the diseases. Now coming to necrotosis. This is apoptosis plus cum necrosis. So here when the apoptosis, certain intracellular pathogens suppress apoptosis by inhibiting caspase 8. Then necrosis starts playing a role along with the apoptosis. Okay. So this is also important, and it is it is dependent on the activity of certain kinase receptors, such as receptor interacting kinase RIPK and the mixed lineage kinase domain MLKL pseudokinase and the RIPK, these two. So again, this type of necroapoptosis, it is implemented or it can take place by 3 pathways. These are the 3 pathways. This is the death domain or death receptor, TNFR1. Okay. And after this is one complex. So this complex then takes 3 pathways. The first is necrotosis, second is apoptosis, and the third one is NF-kB activation. So this NEMO, this can also be traced or used, this complex 1 can be used as a marker for which path the disease is going to take, apoptosis, necrotosis, or NF-kB activation. Mostly here, the cellular immunity comes into play, and sometimes we get the kappa light chains from the B lymphocytes. They also regulate this pathway. Another is netosis. This is seen only in case of neutrophils, and it is caspase free or apoptosis free, caspase independent. Another type of apoptosis is ferroptosis. This is an iron-dependent programmed cell death, and there is decrease in the glutathione peroxidase, resulting in loss in antioxidant capacity, accumulation of lipid reactive oxygen species in cells, leading to oxidative cell death. So the Fenton reaction, which is there for the production of free radicals, this takes the upper hand in this ferroptosis. Then we have pyroptosis. This is characterized by cellular swelling and rupture of pro-inflammatory molecules such as interleukin 1 beta and interleukin 18. It is also caspase dependent. It plays an important role in clearing numerous bacterial and viral infections by eliminating intracellular replication and enhancing the post-defensive responses. This is caspase-dependent pyrotosis. And because in immunology, we are dealing with this only, the pathogen-associated molecular patterns, PAMs, the danger-associated molecular patterns, DAMs, and the nod-like receptors. And a large number of spec card proteins and caspase-1 are recruited to form the respective inflammasome complex. During this process, the procaspase-1 leaves gasdermin D. Gasdermin D acts a perforator of the cell membrane of many cells, including bacterial cells. Again, gasdermin D can be used as a biomarker. And the last one is parthenotos. This is mitochondrial induced damage, and this is there because of excess activation of the ADP ribose and polymerase 1 in response to severe DNA damage. It can also be used for tissue damage. It is there for tissue damage, but it can also be used for therapeutic intervention. So this is just a picture showing the different types of cells which we see under the microscope, under the electron microscope. So the type of vacuoles differ. Like in pyrotosis, this is pyrotosis. The different type vacuoles are here, parthenogen. And then apoptosis, these are the apoptotic bodies. Autophagy, we have the autophagosome. And mitosis, we have the membrane rupture and DNA decondensation and release. The implications of these type of cell deaths are that necrosis will be found in cases of infarction, which is just localized in cell death in a certain area, which lacks uh, the blood supply. Gangrene, toxic injury, ischemic injury, apoptosis can be seen in viral infections, atrophy, immune-mediated diseases, cancer therapy, neurodegenerative diseases, and necrotosis, and again in viral infections, ischemia, reperfusion injury, neurodegenerative disorders, especially in case of human beings, Parkinson's, it is there, myocardial infarction, necrotosis is there. So ferrotosis, again in cancers, neurodegenerative diseases, the intensity of the necrosis is different. Like necrotosis is the most intense as compared to apoptosis or ferrotosis. Pyrotosis, it is seen in septic shock, IBD, arteriosclerosis, and other bacterial infections. Autophagy is seen in case of starvation injury, neurodegenerative diseases, cancer, mitosis, sepsis, autoimmune disease, mastitis, parthenotos and Parkinson's, again, diabetic cardiomyopathy and stroke. So these, the different types of cell death are seen in different types of disease conditions, but there may be an overlapping depending upon the length of the disease or the severity of the disease, or especially in case of cancers. So the conclusions, in short, are that it is a very intricate game where there is a fragile balance between the life and the death of the single cell, and from pro to anti-inflammatory signals for the cell environment. And in future, some of these, after studying the pathogenesis, some of this intermediate, the regulatory proteins or proteases enzymes can be used as markers for the diagnosis of the disease at the right time and also to control the disease at the right time. Thank you very much.
Thank you so much, ma'am, for this important, thought provoking, and highly informative scientific discourse on future perspective on cell death, modalities, and disease implications. Your expertise in pathology and clear presentation have provided valuable perspectives that will greatly benefit researchers and clinicals alike. Thank you so much, ma'am. It was great for having you with us today.
Thank you, Neha, and thank you to the organizers also for giving us this opportunity to speak before the audience. Thank you very much.
Thank you so much, ma'am. Our next speaker is Dr. Vijay Kumar N., Assistant Professor of Economics at Vignan's Foundation for Science, Technology and Research, a NAAC A+ accredited and nationally recognized institution known for its academic excellence, research culture, and commitment to innovation in higher education. Dr. Vijay Kumar is an emerging academician and researcher whose work primarily focuses on rural development economics, sustainable livelihood systems, agriculture and livestock economics, and policy oriented economic studies. Through his teaching and research, he has consistently emphasized the importance of inclusive growth, rural empowerment, and sustainable development practices. He has actively contributed to academic discussions on rural prosperity and socio-economic transformation, particularly in areas related to livestock development, agriculture sustainability, and economic policy interventions for marginalized communities. His research interest reflects a strong commitment to evidence based policy making and the improvement of rural livelihoods through sustainable economic strategies. As a faculty member at Vignan's Foundation for Science, Technology and Research, Dr. Vijay Kumar has been involved in academic mentoring, research activities, and interdisciplinary learning initiatives that bridge economics with real world developmental challenges. His scholarly approach combines theoretically economic perspectives with practical policy relevance, making his work valuable to researchers, students, and policymakers alike. Today, he will deliver his presentation on sustainable livestock development policies and rural livelihoods and economic assessment. His talk is expected to offer important insights into how sustainable livelihood policies can strengthen rural economics, enhance income opportunities, support for security, and contribute to long term socio-economic development. Ladies and gentlemen, please join me in extending a warm and heartfelt welcome to Dr. Vijay Kumar M. The stage is all yours, sirs.
Yeah, ma'am.
Audibility.
Yeah. PowerPoint presentation.
Just ask when it's visible.
Yeah, madam.
Just ask.
So,
Is it visible?
madam, is it visible, my PowerPoint presentation?
Yes, sir, it is visible, sir.
Yeah, right. So, thank you very much, madam, for introducing me in a very systematic manner. So, yeah. Shall I proceed with my presentation?
Yes, sir, you can.
So, very good evening to everyone. So, it's my pleasure to be here to present my PowerPoint presentation on the occasion of first international conference on emerging trends in veterinary and animal husbandry sciences, challenges and opportunities. So, distinguished chair, respected dignitaries, eminent scholars, policymakers, and esteemed participants. So, very warm good evening to all. It is indeed a great honor and privilege to address this distinguished international gathering. A greater honor and privilege to address the distinguished international gathering on topic that is not only academically significant but also deeply relevant to the future global development. So that my topic is sustainable livestock development policies and rural livelihoods, an economic perspective. Here we can see that at a time when the world is facing interconnected challenges such as mainly climate change, food insecurity, rural distress, and inequality, how this livestock sector emerges as a powerful instrument capable of addressing the multiple development goals simultaneously. So you may write one question me also. Can livestock only transform rural economics and become a activator of sustainable development? When we think about economic growth, why do often ignore livestock sector? And you may arise another question also. How many of you think livestock is more than just a milk and meat production? So there are so many questions will arise. So we'll discuss as much as in this PowerPoint presentations. So I told myself Dr. Vijay Kumar and State Professor of Economics, Department of Social Science and Humanities. So at Vignan Foundations, Research Foundations at Guntur. So let's start with our first slide is first livestock as a strategic engine in the global economy. How this livestock sectors plays an important role in the global economy. If you see that livestock sector is a key pillar of the global agriculture economy, contributing nearly about 40% of the agriculture GDP and supporting around 1.3 billion of livelihood for across the worldwide, we can see. If we see that beyond economics, in terms, it plays a vital role, especially nutritional for gaining nutritional security in terms of protein and micronutrients in case of livestock sector. Secondly, employment generations. So we can see especially after agriculture, the dairy sector or livestock sector is a secondary occupation for rural people. Third one is resilience, building the, you can see, buffer against economic and climatic shocks. So here we can see in developing regions, livestock as a living bank, providing liquidity during crisis and stability in uncertain times. Because here we can see that if you talk about nutritional security, more particularly in developing countries where across high quality protein is limited. So in that sense, this livestock plays an important role for getting nutritional support and also generating employment, especially in the rural areas and semi-urban areas, we can see that. And third one is building resilience, acting as a buffer during economic shocks, crop failures, and climate uncertainty. As we know that across the global level, agriculture is now in uncertainty conditions, especially natural hazards, climatic hazards, climate change. So despite of these problems, we should think about an alternate way. So alternate way is nothing but livestock sector, dairy farming. So this is one of the option we can choose that we can improve our living standard. Okay. So in that context, we'll see that how these livestock and rural livelihoods can, in terms of economic perspective, we can see that livestock is a deeply integrated into a small holder farming system, forming a backbone of rural livelihoods. You can see that first is they contribute through multiple channels. We can see that first one is income diversification. Unlike crop failure in agriculture, which is a seasonal and often uncertain, livestock provides a regular and continuous income streams through milks. We can see that even eggs, meat, and other byproducts. They help stabilize the household income. So it's very important that. Next is employment generation. We can see that livestock creates an employment across entire value chain from production to till marketing. We can see that here first one is production channel, processing is there, after that transportation is there, after that lastly marketing. So through this we can create employment to others also in the special in the rural area. So this is particularly significant in the rural areas where non-farm employment opportunities are limited. So this is very important to know that. Third one is women empowerment. We can see that so far in the across the global level, dairy sector or livestock sector is better due to its women playing an important role for successful dairy farming. So here we can see that livestock, especially dairy and poultry, is often managed by women only. So this enhance women financial interdependence in independence, household decisions, making powerful overall gender equity in the rural economics. This is very important. So Apart from that, livestock serves as a key driver for economy, rural economy. We can see that, especially for landless households, marginal farmers, that too of climate vulnerable communities, this livestock farming is one of the important occupations, so that they can improve their living standards. This is very important. So we can see that evidence shows livestock ownership supports mainly poor reduction in the rural area, especially. Apart from that, consumption smoothing, shock observation during climatic variability, we can see that agriculture nowadays were uncertainty conditions. Those from starting land preparation till harvesting, we have made every operations in time, but climate is not in our hand. We are not sure about that our crop yield will get good price for our that commodity. So in that context, this livestock farming is another option to overcome those agriculture certainty problems. That's why livestock development is not just an agriculture; it is a strategy for inclusive growth. It is nothing but overall growth of the farming community. So apart from that, we can see that India is the best example for the world. We can see that especially in the livestock sector. So we can see that Indian livestock sector a model inclusive and sustainable growth. So India represents a remarkable example of livestock rural transformation. Here you can see that this sector contributes over 30% to the agriculture Indian GDP, and also it has a maintained robust growth, often exceeding crop sector growth rates. So India is the largest milk producer. Everybody knows that globally, contributing over 24% of the world milk productions. So this is how the India is modeled to the global level across the earth. So what distinguishes India livestock economy is smallholder dominancy, where millions of rural households depend on two to three dairy animals. They are having small scale poultry units, goat and sheep rearing for their family survivability and their occupations. So this decentralized structure ensures that livestock growth is pro to poor, and it's inclusive one and employment intensive. So this is the most important model for across the global sector in the livestock sector for every country. Now we can see that policy innovations in India lessons for developing country. So everybody knows that developing countries are facing so many problems, especially economic country of the situations of the country. Here we can see that India's success is not an accidental, it is a result of strategic policy interventions. Here we can see that India's success is a livestock development is underpinned by well-designed and targeted policy interventions, enhancing productivity through genetic improvement. Here we can see that one of the best popular program, Rashtriya Gokul Mission, right? It's one of the prominent scheme, launched by the Veterinary Department of Veterinary. That's the government of India. Here mainly the main focuses they will focus on promoting indigenous breeds, introducing advanced reproductive technology as such genomics and IVF. So these things everybody knows that. So expanding artificial inseminations. So here this has led to a significant productivity gains without increasing the herd size. Keep in mind, thereby improving the resource efficiency and environment sustainability. So this is how the policy inventions in India are making better result for features. Okay, here now to address all these things and make it successful dairy farming, livestock farming, the farmer should have good feed and fodder. So if you see that for addressing feed and fodder, we can see that the National Livestock Mission addresses one of the most critical constraints, feed cost, and which accounts nearly 60% of the total production expenses. Okay, so in that farmer has to aware by growing scientific fodder production for their dairy farming. Here mainly we can see that fodder development can be achieved by promoting cultivation of high yielding varieties, so nutritious fodder crops and fodder banks. So because majority of the farmer is not having any irrigation facilities, So in that case also, how to make the fodder production for their dairy or livestock farming, and even pasture management. So go, that also very important. So we can, overcome the problems, especially in the fodder sector, improving the common lands, rotational grazing lands, sustainable pasture management practices. We can see that. So the best example I can quote here. So one of the in Karnataka, one of the universities there, Karnataka Veterinary and Animal Fishery Science University, Bidar. In that institute, one of the sub institute is there, Livestock Research and Information Center in Devani, Bidar. This institute is, earlier I was worked as a assistant professor of, farm. There I have built in, variety of different types of fodder crops, even pasture land development, that for their, dairy farming, even for maintaining good breeds, especially Devani breeds. So now animals are getting good quality fodder for the, survivability. Apart from that, livestock based entrepreneurship can enrich the value added enterprises, especially in the fodder production, feed processing, and allied services. So in the nutshell, we can see that given that feed accounts nearly 60% of the livestock production cost, these interventions directly enhance the farm profitability and economic viability. We can see that. So apart from that, we used to take care about animal health also. This is very more first and foremost important. So for strengthening animal health, so Government of India has, launched various programs. Here we can see that the National Animal Disease Control Programs. Under this scheme, we can see that certain important diseases we can, take care that, especially foot and mouth, prevents the outbreak and control endemic diseases, and improve livestock productivity. Here we can see that, so healthy animals grow better, produce more and more, mortality, and also enhance export potential. So here we can see that disease free status opens global market and increases the competitiveness in the market. So here we can see that build the resilience and animal health system, strengthens the veterinary infrastructure, diagnostic centers, and capacity building programs for farmers, so that farmers can take care of their animals, you know perfectly. So apart from that technology, now we are in the era of, AI, you know artificial intelligence. So make use of best use of those technologies, especially in the digital transformation in the livestock sector. Here India is increasingly leveraging that. We can see that, see, digital livestock database for maintaining successful dairy farming. Farm record should be there. That farm record should be make it in the form of digital transformation. We can see that integrated with the digital records, especially maintaining farm, animal registrars, animals for records, farmers, even resources. So even mobile advisory services, real-time export advices on animal health, nutrition, market base. So all will think in a at a time, so that we can plan for features. Apart from that, AI-driven health and breeding tools. So is to genetically improve breeds has to, we is to make easier for productivity. That also used to take care. Despite of all these, technology has developed, not only in livestock sector, in agriculture sector also they, developed. Even though these sectors are facing some of the challenges, we can see that the emerging challenges in livestock sector, we can see despite of these advancement, the sector faces significant challenge. Mainly we can see that environmental concerns, it's very important, especially greenhouse gases emissions and land degradation, water scarcity. Nowadays we are, during especially summer season, we are facing acute, water scarcity, even for any, humans and also for animals. Okay, so this one has to overcome. And also productivity gaps, we can see that low efficiency in smallholder system. So lack of, maybe lack of awareness, lack of technological improvements, like, so there are so many things we can, come across. So that one has to take care. And limited access technology, farmers are illiterate. So being a, scientist, being a, educator, we is to aware of that, those things for to farmers. And another one is climate change. It's one of the biggest challenge in front of in the world for scientists. Okay, here we can that heat stress affecting the animal productivity, especially in the summer season. So by growing different of fodder crops, we can overcome these problems. Reduce feed and water availability, and market, and institutional constraints also. We can see that price volatility, weak supply chains, and limited access to credit and insurance. So these are the major challenges we are faced by the Indian livestock sector. So this one can be, make it perfect plan. We can overcome these problems. So if you see in the economic insights, some of the key policy transitions, we can see that across the national and global experience, we can see that there are three major transitions are evident. First one is from quantity to productivity. This is very important. So here we can see that improving the output per animal rather than increasing the herd size. This is very important. So within the availability resources, we can improve the productivity percent. That is very important. Second one is from subsidy to smart incentives. So aligning financial support with the sustainable and environmental goals, we used to think about that. Third one is from risk exposure to risk management. So one thought is there, prevention is better than cure. So that is point, it is very important to know about before that. Okay, strengthening the insurance, disease control, and climatic adaptation. So these are the three economic insights, key policies transition we can see in the livestock sector. So coming to the way forward, we can see that a transformative policy framework, we can see that to achieve sustainable livestock development must focus on first one is climate smart technology and practices. No doubt, across the global level, we are the topmost milk producer. But in one side, we are lagging behind in the technological adaptations, especially in the ground level. So that is one has to take care by the scientists and the governments and the developing institutes. Okay, this is one. Second one is smallholder centric value chain integration. So this one has to make improvements. Then only we can achieve in the smallholders, small holding farmers economy, and woman led livestock enterprises. This is very important. Still farmers, women farmers has to make awareness by creating extension capacity building programs, especially on livestock farming. Simultaneously government also has to take care for the helping that to woman led livestock entrepreneurships. And another one is digital and financial inclusion. That is very important. That one also is to take care. And public private partnership nowadays, in agriculture sector, public private partnership is somewhat in a better condition. Same thing if we can apply to in the dairy in livestock sector, we can improve more livestock sector in the across the global level. So this is one of the prime most transformative policy framework in livestock sector. So in a lastly concludatory part, I will say that in a conclusion, livestock is not only merely an economic activity, it is a lifeline for rural livelihood and a pillar of sustainable development. So we should think again and again, because agriculture nowadays we are in uncertainty condition. So simultaneously we have another plan B, that is livestock sector. So the evidence from India across the globe clearly demonstrate that well-designed livestock policies can simultaneously promote economic growth, enhance rural livelihood, and ensure environment sustainability. So it is helpful to the society, is helpful to the environment. The real challenge before us not whether livestock should grow, but how it should grow. That is important. I told no productivity. So efficiently, equitably, and sustainably. So that is important. So let us collectively work toward a future where the livestock systems are productive and also inclusive, resilient, lastly of environmentally sustainable. So this is one of the prime most concludatory part. So lastly, one word I would like to say that transforming livestock system into a engines of sustainable rural prosperity is not just a policy imperative, it is a globally necessity. After agriculture, livestock plays an important role in the global era. So thank you very much for giving an opportunity to present my view on this international conference. Thank you. Thank you, Wanda. Thank you, madam. Hello.
Thank you so much, sir, for your highly informative and insightful presentation. Your talk beautifully demonstrated how economic analysis can contribute to sustainable livestock development and rural prosperity. The way you connected policy frameworks with grassroots livelihood realities provided valuable perspective for all of us. We sincerely appreciate your academic insights, research oriented approach, and meaningful contribution to this session. Thank you once again, sir, for sharing your knowledge and expertise with us.
Thank you, madam. Thank you. Thank you
Thank you.
for giving an opportunity. Thank you.
Now we are privileged to invite Dr. Ankit Magotra, Deputy Director Research at Sher Kashmir University of Agriculture. Okay, so here I start again. Now I'm privileged to invite Dr. Ankit Magotra.
Good evening, Nehaji. May I start?
Yes, sir, you can.
Okay, thank you so much. Thank you.
Thank you so much, sir.
My slides are visible?
Sir, yes, sir, they are.
Okay. So, good evening, everyone. Myself, Dr. Ankit Magotra. At present, I am a Deputy Director Research at Scotch Jammu. So, first of all, I will appreciate the way Dr. Vijay presented his slides. It's very important topic, and he very well said that despite of so much improvement, there are still challenges are there in the field. And one of the biggest challenges we will discuss today that we are very lack of data in field condition, when it is come to animal genetic improvement, whether it is a phenotypic data or a genotypic data. Before going directly to the topic, I just want to give a brief about that, how we'll go for genomic marker panel development for livestock productivity and health. So unless and until we don't have phenotypic as well genotypic data, this is very difficult. But no doubt people are trying that. There are gene panels are there, chips are there, but the accuracy depend upon trait, heritability, and so many factors that we'll discuss in very brief in the topic. So mostly in these slides, I will go with little introduction. Then I will, because earlier I work in Lala Lajpatra University of Veterinary Animal Sciences, my alma mater, and we worked very well there because Lovas is doing great. And there are so many animal farms are there. So whatever I am presenting here, our published work that is related to Lovas. So I will start with that. We know with a very famous quote that we are thinking that we used to think that our fate was in our stars. But as an animal genetics and breeder, we can say when we are going for animal improvement, genetic improvement, that our fate is in our genes, that can be screened, that can be manipulated, that can be further propagated for genetic improvement of animals. So there are different challenges, as an earlier speaker very beautifully explained, that global our population is increasing. There is a war of resources. So as India, if we are going to be Viksit Bharat, we have to work hard in this, especially in livestock sector, because there is huge potential, because there is a climate change that is really affecting the agriculture as well as the livestock. Okay, so in that scenario, if we are going, so there are when there is challenges, no doubt there are opportunities are also there. So how we have to improve the genetic makeup of our animals. This is very important in this challenging world where climate is the issue, where our grazing areas are reducing, where diseases prevalence is more. We are going towards One Health. We are going to where there is a AMR challenge. There huge challenges are there. Or population blast is there. So in that scenario, what is the way forward? How we breeders we have to go ahead? So in that case, this is a very basic traditional method, that is we have to go for selection and mating plans. Unless and until our roots are not strong, it is very difficult to go for a better stock. So selection and mating plan are the two breeding tools that we have to use for genetic improvement. These words sounds very simple, selection, but selection is not simple and real in field condition, because there are n number of traits, n number of genes. There are different genetic and non-genetic factors that actually influence a particular trait. There is an interaction effects are there. So it is very challenging that we have to select the animal and with so accurately, so that we will get the response in future generations. So as we told in a very simple manner, because there is diverse audience is there, participants are there. We are telling that phenotype, our outward experience, our expression depend upon genotype and environment. These both G and E, genotype and environment, are very, very, very important. If G is there, if genotype is good, but if we are not giving that proper environment, the particular expression will not come. And if genotype is not there, आप जितना मर्जी improvement कर लें, however, whatever we will do, we will give good feed, we will good environment, but we will not get the accurate output, or more, we will increase the output. So it is very important that we have to select genotypically important, genotypically superior animals. Then we have to provide a sufficient environment so that we'll get a response that we are expecting. So now, earlier people, what we are doing, this slide, why I want to show this slide, because earlier, no doubt, our and if we will go in 1950s and if we talk about, at that time we have shortage of resources, we need to feed our population, so we are going for production potential, we are trying to increase the production potential of animals, so we are going for crossbreeding, we are simply focusing on milk production trait, but somehow we are neglecting this reproduction and animal health trait. If we'll go for reviews, if we'll search different literature on the internet, there are very few publications are there in India, especially, and even abroad also, where there are different reproductive disorder data is there. Very few publications are there. If I want to say how many repeat breeder cases are there in India, in a particular state, very few studies are there. How many cases are there of metritis in India? Very few cases are there. And breed-wise data is also not there. So we are somehow neglecting our reproductive traits. No doubt, animal health, except mastitis and other, there are so many other diseases are there. Their phenotypic data is not there. So we are mostly focusing on production. But if we'll go for way forward, if we're going for sustainable animal livestock production system, if we are futuring for, and if we are considering all the challenges that I discussed earlier, and we are aiming for Viksit Bharat, we have to take all these traits along with the adaptive traits in our selection criteria. We have to start from now onwards to generate all this data in a common data bank, so that we can further associate with the genomic data, so that we can come out with some results. So there are different traits, as I'm telling, different traits are there. There are different traits that are affected, they are having different heritability. Heritability in a nutshell, I'm telling you how much a particular trait is affected, how much genetic potential is a trait, but how much the genetic variation is there. That will be transferred from parent to offspring. Okay, that is not environment. So trait-wise heritability varies, and how this genes will transfer. We know that there is from parental, or from 50% from father side and mother side, these genes are transferring. So when we are selecting, we have to take care of the paternal side also, maternal data also. So if we are telling about when we are going with genomic panel, we are mostly a very common term people mostly use, that is a marker assisted selection. This marker means there are number of markers, biochemical markers are there, blood markers are there, chromosomal markers are there. But at genomic marker, we can say the variation at genomic level. What are the different variations at gene sequences are there that we can associate with the phenotypic data, so that further can be exploited for selection of animals at early age. So this is a different types of markers are already reported in some breeds. So what are the markers in, we can say, if we are taking a single marker, double marker, triple marker, we can say if we are taking a few markers and selecting individual for a particular trait. For example, in case of sheep, we have a fecundity genes are there that can be used for litter size. Even for a pig, there is a halothane gene that can be used as a marker for PSC syndrome. Likewise, a DGAT gene is for milk fat. These are the markers that can be used. But the traits like production, reproduction traits, these are quantitative traits. These are polygen affected by number of genes. So in that case, we need n number of markers. We have to select animal based on n number of markers. So in that case, not only we have to take care of markers, we have to take care of linked markers that can be further transformed as it is. So in the marker assisted selection, if we are taking n number of markers, we can say we are going towards genomic selection, where it is a type of marker selection where we are selecting animals based on n number of traits at genomic level. Again, genomic selection accuracy depend only when we have phenotypic data. If we are taking a Bos Taurus chip and we are applying on our indigenous chip, and that for a particular trait that is low heritable, our output we will not get that much output or fruitful output. That can be good for publication, but for field oriented change, if we need to generate our own animal breed wise data, whether it is a phenotypic or a genotypic data. So if we are coming to basic, what is marker, DNA marker? These are the genomic variations that are present on a DNA in our sequences. As we know, in cattle 60 chromosomes are there, in sheep there are 54, goat 60 chromosomes are there, pig 38, even human 46 chromosomes are there. Chromosomes, genes are present on chromosome in a linear manner. Okay, so in every, what are the nucleotide sequence, we are knowing that adenine, ATGC, adenine, guanine, thymine, cytosine, these are the sequences are there, and these are imprinted in our genome. So if we are getting any variation in these markers, variation in sequence, we can identify using different markers. For example, very common, very good, very reliable marker, that is a PCR RFLP marker is there, RAPD marker is there, RFLP marker is there, mini satellite, microsatellite markers are there, that mostly we are using for diversity analysis. However, but for selection of animals for production and reproduction trait, SNP, that is single nucleotide polymer marker, is very, very effective and worldwide used. So what is SNP marker in this particular diagram I am telling you? It is not so easy to, we can say that particular SNP we can consider it as a candidate marker. In a very, this picture, if we look, there are 6 individuals are there, and we categorize first 3 individual having a low RFI, and 4, 5, 6, next 3 individual as a higher RFI, residual field intake. We classify, we have phenotypic data, and this is just example for learning of audience I generated is how we can identify the marker. For example, we did we based on phenotypic data, we classify these animals, and further particular gene for whole genome, we did the SNP analysis, whole genome analysis. And at a particular level, we found that particular position, first position, in first 3 individuals, AAE genotype is there. And in second group, AA is there, but C is also there. So in that first line, we can't say that A to C variation, or we can consider it as a marker, because in both the groups, address A is there, and second group also adenine is there. Similar is case the second. Here in second, in first group, both C and T, both nucleotides are there. Similarly, in second group, both C and T. Likewise, in all, if we will classify, we will see all the nucleotides loci. We can say in fourth number of loci that we highlighted, when we will get this kind of SNP, where in particular group, no, it is very difficult. I'm just giving you example. We have to go with percentage wise. But if we'll get this kind of marker, where in a particular group we are having low RFI, at a particular locus we are getting a, and in other locus we are getting a G, we can say it can be used as a marker that can be further validated on a larger population size. So likewise, because if you are going for sequencing, you will get n number of nucleotide variations are there. But when we can say that is a candidate SNP or nucleotide variation, that can be used in marker panel for selection of individual, that we have to see. See, in this example, I want to say, if we don't have phenotypic data, if it is very difficult to classify animals. If there are 6 individuals, I go for sequencing, we don't know with how we will associate. So both phenotypic, if there is no phenotypic data, our accuracy with genotypic data and selection and response is very low. So when we identified the mutation, then there are different types of mutations are there. For example, point mutation, when there is a purine to purine change, we can say it is a transition. When it is a purine to pyrimidine or vice versa, we can say it is a transversion. And further, sometime in our sequences, there are insertion and deletions of nucleotides also there that directly affect the gene regulation. That is also mostly in disease conditions. We are using these as a markers. In cancer cases, in dog tumors, we are mostly finding this insertion and deletion cases that can be used as a diagnostic marker in case of tumors in dogs and cats. So similar way, inversions and all there. For example, this one, multiple sequences we did in our lab in LUAS in animal genetics and breeding. Whole team we did that. In that, I just want to show that there are 3 sequences are there. There are variations are there. For example, in first, where I am pointing the pointer at 180 position, where I highlighted in yellow, there is A to C mutation is there. So we can say whether it is a transition or transversion. As I told, if it is purine to purine, it is transition and transversion. Okay. Similar way, other variations is also there that can be used through multiple sequencing alignment. We can identify the positions where the changes are there. Then after that, we want to know whether if these variations are in coding sequences, if there is present on exon sequence, we want to know whether these mutations are silent, synonymous mutation, or non-synonymous mutation. What are the silent mutation? In silent mutation, we can say there is a change in nucleotide, for example here, but there is no change in amino acid. We can say these are the silent mutation, where there is change in amino acid, nucleotide sequence is there, but there is no change in the amino acid. Whether it is, we can say it is silent mutation or synonymous mutation. Similar way, if there is a change in nucleotides and that lead to change in amino acid, these are known as non-synonymous mutation and missense mutation. And this is mostly if we are getting this type of mutation in exonic region, somehow in some pathways these are related to some disease mostly. So sometimes there are codons are there that will enter and lead to stop codon, and then what happened, the protein synthesis will stop, and these are known as nonsense mutations. Likewise, frame shift mutations. Okay, so once we know that this is a beta defensin sequence is there, one of our PhD student in Luas from biochemistry, she did work in Hardenu cattle, and they found these mutations in our mastitis and non-mastitis animal, and they want to know whether these mutations are having any, these are the exonic sequences, a sequence, and they want to know whether these mutations are having any effect on the amino acid or not. And after sequencing, we identified the mutation, and we found that, and that these through expressive tool, because there are different bioinformatic tools that can be used for multi-sequencing alignment translation of nucleotides, and we identified that these mutations lead to amino acid change, even that lead to some deletions also. So we identified, because see, when we are working in the genomics lab, suppose we, as I told, if we don't have phenotypic data, genotypic data is there, we can use these small studies, bioinformatics, using bioinformatic tools to publish good papers that can be used by further scientists having phenotypic data they can associate in their herd. So we identify whatever the mutation we got, out of that mutation, one is synonymous, two is synonymous, some are non-synonymous, and also we got one mutation at 260 mutation that lead to stop codon. So that these are the, and some linked SNPs we got. So once we identified these, we associated this with the clinical mastitis cases, and we found a very good result. No doubt these are the polygenic trait, but somehow we can say that this particular SNP at this particular position can be used in a marker panel. That because when we are getting whole genome data, we are getting n number of genes. Further, we have to validate. If we want to more accuracy, we have to validate these particular mutations in our resource population using PCR or FLP or other technique. That then only we can say these mutations can be used in SNP panels that can be further used in different breeds. So when we are going for sequencing, we can go for there are different techniques like whole genome Sanger sequencing is there, DNA microarray is there. Okay, whole genome sequencing is there. So if we are going for genomic sequencing, I'm telling genomic sequences, we need a reference population. Now, reference population size, there is debatable. We can say if we need more accuracy, we need more population. But how many population? For how many population we require? So once we have a population, we need phenotypic as well as genotypic data. Based on that, we will file some prediction equation and we can validate, or we can estimate a genomic breeding value. So the population depend upon the trait heritability. See, this particular graph shows very beautifully that if the trait is having low heritability, if you need accuracy, at 0.6 accuracy, you need minimum 10,000 animals reference population data. Okay. If you want to calculate any, if you go for genomic selection, if somebody is telling I'm going to select animal for reproduction trait using gene chip, okay, I having a reference population of 100 only, then I think it is a waste of money. We have to increase the reference population size. Initially, it is okay. We can say that can we encourage, we can get some data. But in a longer run, in a broader Indian prospect, we need a common data bank, a common database, and common genomic database that can be used for selection. So this is how heritability of trait matters and how we can select the reference population size. Trait to trait it vary. So once unless and until we don't have a traditional breeding data, genomic selection is not this much effective. So till now, globally we have different gene chips data of mostly of exotic breeds of different species. In India also, NDDB is claiming that they are having some indigenous gene chip data is there, and they are doing wonderful job. And other scientists in NBGR, NDRA, LUAS, people are working on this, and they are coming with very good publications, having identified some markers that can be further customized and can be used in selection criteria. Likewise, what is our target? What we are doing in LUAS? Likewise, in human, there are different gene panels are there. Based on mRNA panels and based on SNP panels, they identified the genes and they can go for diagnostic in humans. Like if you if there is a variation in this panel, differential expression in these panels, that particular individual can be diagnosed for cancer or other diseases. Likewise, in LUAS, we are also working in this side. We are identifying some SNP markers that are associated with body weight and litter size. We in goats especially, we gathered a phenotypic data. No doubt, population size is less. We collected a phenotypic data as well as the genotypic data from from different field, and we have a very good farm at LUAS also. So we identified we collected the data, we collected the blood samples, and we categorized animal phenotypic data, as you were told. We through ultrasonography we categorize different species, different animals having twins, singles, and non-pregnant animals. And further, we used different SNPs, mRNA-based panels to check the association, whether there are any association analyses are there or not. So in this particular sequence, we use n number of battery of genes, and we identified very good marker panel that is published also in a very good journal, GDF9, TLR2 expression panel. Recently it is published in Zygote journal, leptin gene panel, BRCA panel, KIS1 gene panel. That can be used, this particular target can be used to identify animals having a higher body weight and having a more litter size in our target resource population, and further it can be used after validating on large population size. So similar way, whole genome association we also did, and we identified some SNP panel genes that can be used, that we identified some SNPs of a particular genes of more than 40 genes that we can use to differentially express, or we can select animals giving more litter, and accuracy, noted accuracy is only 60% in that case. We are working on larger sample size further. So in a similar trend, we are working in cattle also. This is a work of our PhD student at LUAS, Dr. Pradeep Chaudhary, published in Omics Journal, where we selected two breeds, indigenous breeds, Sahiwal and Bilahi cattle. Here what we did, we identified some gene panels that are associated with the adaptability traits. We identified these gene panels, and we generated IPR also as a copy data of these channels with from LUAS only. So these gene panels further we can use to identify the animals these are the genes in an indigenous breed that is not reported in Bos Taurus, that are associated with the adaptability traits. So if we are going for climate resilient breeds, we have to focus on these genes for propagation. So we identified these in our indigenous Sahiwal and Bilahi breed. So this is also very beautiful study. We filed a patent of also from LUAS itself, where we identified with some markers and some AI tools we use to we customize some algorithm that can be used to predict at farmer, because no doubt we know that ultrasonography is banned due to PNDA Act. We can't use in field. So we prepared a device, simple device that we proposed that device, and we filed a patent that is published, and soon hopefully we'll get the grant, that we can at 3 months in field condition, we can with 80% accuracy we can say whether animal is carrying twins or single, if it is carrying more litter or single. So based on marker, no doubt after marker also, based on phenotypic data also, using AI algorithm, we prepared this algorithm that we filed to identify the prenatal litter size in goats. So otherwise, apart from that, in our in LUAS, in animal genomics lab, animal genetics breeding department, we further screened these all genes, and we associated with these genes not only with mastitis, we associated these genes with reproductive disorder traits also, with reproductive disorder traits that like mastitis, metritis, dystocia, and we identified very important SNPs, very significant associated SNPs that we reported in a publication that can be used in SNP panels for our indigenous breed if further we are going for customization. So likewise, we are working on mRNA panels also. Like when we, as I told you, when we in our project, we are working on sheep. So we covered all the aspects. If we go for reverse genetics, we started with expression panel. What are the differential expression genes are there in high litter and low litter animals? When we go for the SNP panel. So earlier I discussed the SNPs. So we also filed one more patent from LUAS itself, funded by Haryana Science and Technology, that we identified mRNA based panels that can be used to identify that whether these are animals carrying more litter or less litter. So apart from that, there are trial studies in sheep also we did. See in this photograph, this is a 3-month lamb. If somebody, I will tell the 3-month lamb, the body weight, approx body weight, mostly people are carrying 13 kg or 12 based, depending on the breed. This is a Munjal breed, and other one twins that are the Harnali breed we are maintaining at LUAS. These are the 3-month lambs having a body weight of 25 kg. So if you are going for broiler production in case of sheep, so how this it is going on? Because we are working there on some immunomodulators from birth up to 3 months. As per our data, we improve the body weight as well as the we reduce the mortality rate less than 1% in sheep farm. And when we found a significant result in differential groups, that that some animals are giving this much output, what are the genes that lead to this expression in body weight and other traits? We did transcriptome analysis. The data is not yet published. Transcriptome analysis, and we identified the set of the genes that are upregulated and downregulated in our resource population. So if we are having a farm, if we have animal data, so we have to categorize the animal based on the data, phenotypic data first. Then only we have to apply whether we have to go for MR analysis. It depends upon at what time you are collecting blood or going for SNP analysis. So with the help of whole genome, we identify the genes that are differentially expressed that is related to increase in body weight. Because we are using up to 3 months, we use the immunomodulator combination that I'm not going to discuss right now. So there is an effect of that immunomodulator combination on the body weight. So we identified these genes that are highly differentially expressed in low body weight group and high body weight group. And further, our scientists at LUAS, now they are working on the genes at SNP level, whether there is an expression variation or there is an interaction effect, they are working on that. So similar way, we identified, as I told, this is a very, very good study published by our master student at LUAS, that they identified we know that leptin is a very candidate gene, earlier also reported by so many scientists. But for reproductive disorder and reproductive traits, very few studies are there, and at particular locus, we found a very significant association of this particular SNP with the AI per conception as well as the milk production traits. So similar way, in goats, we identified some SNPs at an intronic position also that is affecting the transcription factor binding sites. That is very, very novel finding that we reported first time in our goat population and in Indian population. Similar way, we evaluated the different immune panel genes in buffalo as well as cattle in our population at LUAS farm, and we found a significant association. And these panels can be further used in selection criteria when we are going for chip selection or if we are going for customized chips. So this is also part of my PhD work at NDRA, where we also identified a breast cancer gene. We know that breast cancer gene is a candidate marker of breast cancer in humans. Similar way in cattle also for mastitis, clinical mastitis, this genes is showing a wonderful result, wonderful candidate marker that can be used for diagnosis. Even we can go, once we came to know that a particular genotype, susceptible genotype is there, so we can go for genetic counseling, or we can modulate our management conditions. The animals that are more prone can be, if they are existing in farm, that can be more taken care. And further, when we are going for selection of bulls, we have to select animals with GG and TT genotype that are less susceptible to mastitis, so that we will get the future more resistant progenies that are more adaptable to our climatic conditions. Now, where we are now, we, as Dr. Vijay earlier studies, we are doing wonderful job, no doubt. We are doing in every aspect. Every institute is doing wonderful job. They are doing their best in all the aspects. But what is the problems that we have to work for? We have a smaller herds in Indian condition. We have diverse climatic condition, low input, poor management. No doubt, these things we know. Now, what we have to do, but main thing, what I'm telling, we don't have data, authentic data. Unless and until we don't have data, we can't go for our own indigenous chip, our indigenous mRNA panels. It is very difficult to select or label our indigenous breeds that we have to go for. So we have to work on a well-developed genetic evaluation program, that is common genetic evaluation program in India. We have to go for wide use of AI per sires, and that we have to take care that when we are selecting sires, suppose we are taking a semen from a particular agency, the same sire we are using in Punjab, same sire we are using in Jammu, same sire we are using in Haryana, same sire we are using in Gujarat. So in a broader respect, we are thinking that lead to more inbreeding, that consequences will come in after 8 years, 7 to 8 years. So when we have there, a national level, one strategy must be there that sires, when we are selecting, we have to take care that their diverse sires will be used, because when we are going to hire a sire, like people now we are using a sex semen, we are taking, there are two companies are there, mostly ABS Genus and STS Technologies, but same sire they are giving all to all the mostly all the states. So we have to take care, we have to, when we are selecting sire, we go for wider number, we will go for more bulls. So we will take care, we will avoid the inbreeding also. So we have to focus more on progeny testing programs, no doubt. We have to integrate the genomics with the progeny testing program. At a national level, common progeny testing program must be there, so that more accuracy will be there, and more in the longer run we will get more wonderful results. So thank you so much. Any questions? Kindly let me know. नेहा जी, मेरी आवाज आ रही? नेहा जी, आपको आवाज आ रही है मेरी?
हाँ जी सर, हाँ जी आ रही है.
Okay. Any questions? If somebody can ask.
If anyone is having any questions, they can drop their questions in the chat box.
Thank you. Thank you. Thank you, Neha ji. Thank you.
Thank you, sir. It was really an excellent presentation on modern genomics, and we are really grateful to have you right here as a speaker today. Thank you so much, sir. Now we are delighted to welcome Professor Dr. Indramani Nath, Professor and Head of Veterinary Surgery and Radiology at the School of Veterinary and Animal Sciences, SAU's CUTM, Parilkhmundi, Gajapati, Odisha. He is a distinguished veterinary surgeon, academician, and clinician with extensive experience in veterinary surgery, diagnostic imaging, wildlife health, and large animal management. Professor Nath has devoted many years to veterinary education, clinical practice, and research, contributing significantly to the advancement of animal healthcare and veterinary sciences. As the head of Department of Veterinary Surgery and Radiology, he has played an important role in strengthening clinical training, promoting research oriented learning, and mentoring young veterinary professionals. His academic and professional work particularly focuses on advanced surgical techniques, radiology diagnostic, emergency veterinarian care, and wildlife health management. He is widely appreciated for combining scientific expertise with practical field experience, especially in handling complex cases involving large animals and elephants. Over the years, Professor Nath has actively participated in national seminars, veterinary workshops, and scientific conferences, sharing his expertise on animal surgery, conservation medicine, and field based veterinary challenges. His contribution toward animal welfare and wildlife healthcare reflects a deep commitment to both science and conservation. Today, he will speak on elephants, challenges, innovations, and field realities. His presentation is expected to provide rare and valuable insights into elephant healthcare, field realities faced by veterinarians, modern innovations in wildlife treatment, and the challenges involved in the management and conservation of these magnificent animals. Ladies and gentlemen, please join me in extending a hearty and respectful welcome to Professor Dr. Indramani Nath. The stage is all yours, sirs.
Madam, my screen visible?
Yes, sir, your screen is visible. You can start, sir.
My topic is treating elephants, challenges, innovations, and field realities. As you know, elephant embodies the ecological balance. It is associated to our cultural pride and nation's heritage animal. It is a Schedule 1 animal, endangered by ICAVHS. Its number is decreased by over 50% in past 3 decades because of habit fragmentation, poaching, human-elephant conflict, and disease. As a veterinarian, we are concerned with the responsible for disease diagnosis, control, treatment, and capture. Challenges. As you know, the ownership of elephant, it belongs to the forest department. So there should be the proactive communication to veterinary department for early intervention. Proper requisition with permission for chemical immobilization is essential. Here, one most important thing is non-availability of functional tranquilizing gums, medicines, because medicines are mostly imported drugs and they have very narrow margin of expiry date. And still, the gun and the medicine, they are under the control of the forest department. And there are lack of trained wildlife veterinarians due to absence of specific cadre in the forest department. As we should not remember the recent loss of Samikya Reddy and one Kerala veterinarian in the Bantara. And because it is controlled by the forest department, most of the states, forest department is not allowing the private veterinary colleges to procure gun and medicine. I don't know whether Apollo College is having the gun and medicine. Because how, if they will not have the gun and medicine, how they will get training? And for diagnosis, the importance of BSL-2 lab with NABL accreditation is most important for quick and precise diagnosis of the wildlife cases involving the elephant. Here in Odisha, we are having a BSL-2 lab with all the facilities. Once one elephant sample presented to my laboratory, wildlife center, first we go for DNA extraction, then target amplification, Sanger sequencing, and then bioanalysis to determine the sex, which is the animal, the species of the animal. So this is the essential requirement for wildlife diagnosis. And in most of the places in the state, we are having only one. Every state, maybe more places of wildlife importance should develop this BSL-2 laboratory for early diagnosis and therapeutic measures. And here, important is one qPCR test for early and precise detection of pathogens. They monitor the viral load. We detect the virus from the fecal bronchus. This helps in early detection so that we can plan the therapeutic intervention and improve survival rate. By the next gen sequencing, to discover the microbial diversity, to detect Clostridium novae and Clostridium septicum as the common pathogen in diseased elephant of Odisha. Sanger sequencing is the gold standard for DNA sequencing. It is most important in wildlife forensic and genetic study of the elephant. So, application of this helps in determining the genetic relationship and the pathogen strain type. In Odisha, by collecting the sample from different regions of the Mayurbhanj, Bamra, Venkanal, Onugul, and different Cuttack division, we could able to detect the species of the male and female. And this is we have isolated different organisms, bacteria involved for the death of the elephant. We are also estimating fecal glucocorticoid metabolite cortisol level to determine the stress. Once elevated cortisol level, they compromise immunity and they make prone the free-ranging animals to the different diseases. And we have found that in Dhenkanal Forest Division of Odisha, they are having more prone to this environment because of lot of mine active, mineral, railway, electrification. They all occur in this forest division, making prone to the different diseases. And now one important disease of concern is elephant endotheliotropic herpes virus. It is having high mortality rate. It affects elephants of 2 to 10 years of age. Transmission through mucosal secretions. Diagnosis only by qPCR. Symptoms: cyanotic tongue, lethargy, swelling in the temporal region. And here we are collecting the trunk wash from the rescued elephants and we determine the virus load. These are some of the elephants suffering from the EHIV, and you can see the dullness, lethargy, bluish tongue, and edema. On postmortem examination, these are the important findings. Hemorrhage almost all the visceral organs, cyanotic tongue, and in histopathology, inclusion bodies in the visceral organs. Anthrax is another disease. Here we get very little chance to treat, and there is one postmortem exam we could able to detect this. And most important thing is preventive vaccination of the peripheral villages nearing the sanctuaries is most essential. This is hemorrhagic septicemia we have detected in elephants of Odisha. And these are the symptoms. And we have a very bad experience of in Korlapet Wildlife Sanctuary, 7 elephants dead in very less time. And we could able to detect this on postmortem examination. And these are the details of the postmortem examination. And we have detected Pasteurella multisoda in the organism. And regarding innovation in the therapeutics, and we are here using in captive elephants of Nandan Zoo as well as the Kapilas Rescue Center, also Chandaka Elephant Sanctuary, very successfully aciclovir, rectal, oral, and IV administration, along with the supportive fluid therapy, antibiotic analgesics. This is the different treatment schedules we have very successfully used for treating the rescued baby elephants affected with higher level of virus load with EHV infection. This is one elephant, because the rescued elephants, once they become recombinant, it is very difficult to make them survive. So we keep in a sling, we offer feed and water, and under sedation, we administer fluid therapy. Once the virus lowers, otherwise rectal, butorphanol administration. And you can see once it recovered from anesthesia, it is making the utensil, water utensil upside down because it is a wild elephant. So we should have one dedicated approach and anesthesia and 24-hour care. Now coming to the anesthesia, because this is also a challenge. Capture of the wild elephant, disease diagnosis, and a treatment purpose. The xylazine ketamine combination, it is the best anesthetic, and it provides standing sedation, less risk to the animal. And once it is tranquilized, we use this innovative technique of keeping the animal in stand. It is having an abscess, I am draining. So immediately once the animal is immediately, so that animal will not sink down during course of treatment. And once the animal is sink down, immediate care should be taken to make it stand, sometimes by using pulley if it is less weight, and heavy elephant, we are making it stand and keep it in sling by iron platforms. Sometimes some rogue elephants, in a day there is severe human-elephant conflict, and this elephant killed about 5% a day. So the DFO immediately called me. I roam behind the elephant. In the night, I could able to detect it because it is demanding. We are usually taught that an animal should not be tranquilized in night, but switches warranted me, and I have tranquilized in the night. And you can see the blindfolding. And to decrease the aggression, we have trimmed some of the portion of tusk, and we rescue it and kept in the rescue center. While giving anesthesia, most important thing is the judicious use of antidote and proper dose. Is the aim in the antidote and use of insulin syringe. Yohimbine is the partial antidote and etipomazel is the pure antidote. If this is given, you are very safe. But many times these drugs are important and not available freely at the time of need. They are having very good analgesic property. They are predictable action. They can be reversed by antidote, but one thing, they don't have the muscle action property. And another, if underdosing, there is excitation, animal is very severely excited, and I will show one case of accident. There is underdosing of opioid on captive elephant in West. These drugs are important that the drug and the antidote, they are available in the same. And if the antidote is partial antidote or pure antidote, you should take a note of this. This is divinorphin, it is partial antidote. So by chance you will give either side of the drug, instead of recovering, it will go on further depression. Because sometimes the local public, the forest department, they will pressurize, reviving from anesthesia, give little bit more, give little bit more. But you should know that you should not go for higher side of the partial antidote. This is the pure antidote. You are very comfortable. If you are having the pure antidote, even if higher dose, nothing will happen. And even if you are using opiate drugs, here I have one elephant recombinant, but to test the degree of sedation, one forest people went and introduced one grass blade into the ear. He should not do that. Sudden stimulation, elephant got up and ran away. That forester would able to very. Even if it highly in deep degree of sedation, you should not stimulate it. And this is the thing I have to describe. This is one captive elephant. It was in the mosque, and the regular Mahut was not there. So the reliever who was there, he was unaware of the mosque. So the mosque and broke the chain, intruded into the nearby village. He killed 5 persons. It was tranquilized and brought back. Next day, when it again able to break the chain, the Jew vet was ready with 2 darts, one xylazine ketamine and one immobilian. In a hurry, he administered immobilian, and which pierced subcutaneously. As I have already told, opiate, once underdosing, excitation, it broke its chain because it was up-fed. It was very intelligent animal. It was knowing where it is feed is there. So it broke the feed, the feed stock room, started eating. So started eating, then anesthesia started working. So what will happen? And you see the animal died it and it in the
Thank you very much, sir, for this unique and insightful presentation on elephant health and management. Your practical experiences and scientific insights greatly enriched our understanding of wildlife, healthcare, and field veterinarian challenges. We sincerely appreciate your valuable contribution and inspiring expertise. Thank you once again, Professor Dr. Indramanina. Thank you so much, sir. And finally, for the last talk of this session, we are honored to have Dr. Suresh J. Jadhav, Professor and Head Department of Veterinary Parasitology, Nagpur Veterinary College. He is distinguished academician and researcher with extensive expertise in veterinary parasitology, livestock disease, and diagnostic sciences. Dr. Jadhav has contributed significantly to veterinary education, research, and disease management, particularly in the areas of parasite and hemoprotozoan diseases affecting livestock. He is widely recognized for his work in improving diagnostic approaches, disease surveillance, and therapeutic strategies for economically important animal diseases. With years of teaching, research, and clinical experience, he has guided many students and actively participated in scientific conferences, training programs, and research initiatives related to animal health and livestock productivity. Today, he will speak on important hemoprotozoan disease of livestock, challenges in current diagnostic and therapeutics, and update. Ladies and gentlemen, please welcome Dr. Suresh J. Jadhav with a big round of applause.
Neha madam,
Yes, sir.
my presentation is visible?
Yes, sir, it is visible.
Okay. So, good evening, respected chairperson, dignitaries, faculty members, and their participants. I am going to talk on important hemoprotozoan diseases of livestock, challenges in current diagnostic and therapeutics, and update. Hemoprotozoan diseases such as theileriosis, babesiosis, anaplasmosis, and trypanosomosis cause major economic losses in livestock through reduced productivity, mortality, and treatment cost. This presentation highlights their importance, recent advances in diagnostic techniques, emerging therapeutic approaches, and growing challenges of drug resistance and vector control. Now, hemoprotozoan diseases, you see this slide, hemoprotozoan diseases cause a major economic burden on the livestock sector. Among these diseases, theileriosis accounts for the highest loss, estimated at around 8,426.7 crore rupees, mainly due to reduced milk production, mortality, and treatment expenses. While trypanosomosis contributes losses of about 1,125 crore rupees, while babesiosis and anaplasmosis account for approximately more than 551 crore and more than 262 crore rupees respectively. In addition to disease losses, farmers spend nearly 4,353 crore rupees annually on tick control measures. Altogether, the total economic loss due to these diseases and their control exceed 12,717 crore rupees. You see, these figures clearly highlight the urgent need for effective surveillance, early diagnosis, integrated tick management, and improved therapeutic strategies to reduce economic losses and improve livestock productivity. You see, in next slide, you see this table. This table compares the major hematoprotozoan diseases of livestock like babesiosis, theileriosis, trypanosomosis, and anaplasmosis. Babesiosis is caused by Babesia species such as Babesia bovis and Babesia bigemina. These are intracellular parasites found inside red blood cells and are mainly transmitted by ticks. Theileriosis is caused by Theileria species like Theileria annulata and Theileria orientalis. These organisms occur inside both the RBCs and white blood cells, especially watch blue bodies, and are also tick-borne. Trypanosomosis is caused by the Trypanosoma evansi and Trypanosoma vivax. Is extracellular and found outside RBCs. It is mainly transmitted by biting flies. Then anaplasmosis is caused by Anaplasma marginale and Anaplasma centrale, which are intracellular rickettsial organisms present inside RBC and spread through ticks and flies. You see, we will not discuss pathogenesis and life cycle of the parasite. It is a big topic. We will discuss about the sign and symptoms. Here, in case of the babesiosis, theileriosis, trypanosomosis, all they show the high temperature, more than 105 degree Fahrenheit. Except in anaplasmosis, the temperature is more but less than 105 degree Fahrenheit. While in babesiosis, there is inappetence. In anaplasmosis also, there is inappetence. Anemia is seen in all 4 diseases. And then there is a coffee brown color urine in case of babesiosis. And in case of theileriosis, there is a superficial lymph node swelling. Then you see, I'm having some of the pictures while treating the animals. I have collected these pictures. You see, in the second picture, there is an enlargement of superficial lymph nodes. In case of the theileriosis, it is a clear sign, which we can say that the animal is suffering from the theileriosis. Again, here you see the watery nasal discharge, then lacrimation, depression, lack of appetite, conjunctival hemorrhages, subconjunctival hemorrhages, then chemosis, exophthalmosis. In case of anaplasmosis, you may find the exophthalmosis. It may be unilateral or it may be bilateral. You see in the first picture, there is one eye is infected. And in second picture, both eyes are infected, showing the exophthalmosis. Then this is in first picture, there is a diarrhea with mucus and blood clot. This is a typical sign in early infection of the theileriosis. Right. Then swelling of right carpal joint is also the symptom. Then you see in the hematoprotozoan infection, pseudopericarditis, that is a string-like jugular vein, and skin of the animals will get rough. Then this is a typical sign in case of the trypanosomosis, corneal opacity. If animal is untreated, then it may get blind also. Now, on the basis of the signs and symptom, we can diagnose the disease condition, but for the confirmatory diagnosis, we have to go for the blood smear examination, hematological test, serological test, and molecular tests. For blood smear examination, we have to collect the bloods from the different animals from the different sites. You see, in case of cattle buffalo, we have to collect the blood from jugular vein. If we are going for the DNA extractions or PCR diagnosis, but if we are preparing the blood smear for microscopic examination, then we have to collect the blood from the peripheral vein, ear vein of the animals, because all the parasites, they are having high weight. That's why they are thrown towards the peripheral vein of the animals. So whenever we collect the blood from the ear vein of the animal and prepare the smear, we can see the parasites. So here you see how we can prepare the thin blood smear as well as thick blood smear. And if we want to diagnose rapidly the hematoprotozoan infection in the field condition, if animal is suspected for trypanosomosis, say for example, or it is suspected for babesiosis, we can collect a drop of blood on the glass slide, then apply the drop of distilled water, apply cover slip and observe under microscope. If there is a trypanosomes which are having flagella, they show the jerky movements in the blood. On that basis, we can say that that animal is suffering from the trypanosomosis. And in case of babesiosis, they show the jerky movement, but they are little slow. So in next slide, we can see how we can prepare the blood smears from the ear vein of the animal. And this is here, you can see the thin blood smear as well as thick blood smear. And after preparation of the smear, we can bring the slides, air dry it, bring it in the laboratory. We can use Lisman stain or either we can use Giemsa stain. After staining, we can observe under microscope, you see the red color, they are the RBCs and WBCs are also there. I have given the number, like first number is neutrophil, then second number is eosinophil. Likewise, you see the 8th number RBC. It is having a pyroplasm. I will see, I am having more pictures from the field. You see here, this is a stain sample. Here you can see this is the RBC having this pyroplasms. In second picture, you see there are the lymphocytes and the clear cytoplasm is visible, which is containing the granules. That granules are nothing but the pouch blue body, right? Then in another slide, you see these RBCs and flagellate organisms are there. They are the trypanosoma. Then here at the center, you observe the RBC having pyroplasm, that is a Babesia bigemina. In another slide, you can see the anaplasma marginale and here Theileria annulata. It is very difficult to identify marginale and Theileria annulata under the microscope because morphologically they don't have much difference. For that, we have to go for the another. You see here, microscopy is a gold standard for the field experimentation. It is cheapest, but it is having some limitations: low sensitivity in chronic infection, observer dependent variability, inability to detect the mixed infection. Despite available methods, diagnosis remain a major challenge. This is due to low parasitemia in chronic infection, presence of carrier animals, and occurrence of mixed infections. Additionally, serological tests often show cross-reactivity, reducing their specificity. These factors results in underdiagnosis and delayed treatment, especially under field conditions. So, recent advances in diagnosis include molecular tools such as PCR and real-time PCR, which can detect even low level of infection. Then loop-mediated isothermal amplification or LAMP is an emerging technique that is rapid, sensitive, and suitable for field use, as it does not require sophisticated laboratory equipments. Then the commonly used drugs for the treatment of these diseases include dimeazosin aceturate, imidocarb, bupivacaine. In addition to specific therapy, supportive treatments such as fluid therapy and hematinics is essential for recovery. Early diagnosis plays a crucial role in successful treatment. Then one of the major concerns in therapeutics is the development of drug resistance. Indiscriminate and repeated use of drugs has led to reduced efficacy in many cases. Some drugs also have toxicity issues, limiting their safe use. Furthermore, treated animals may remain carrier, leading to relapse and continued transmission. Then control of vectors, especially ticks, is an important aspect of disease management. However, widespread resistance to acaricides has made vector control increasingly difficult. Improper use and lack of rotation of acaricides further contribute to this problem. Therefore, integrated vector management strategies are required. Recent research is focused on developing improved diagnostic tools, novel drug delivery system using nanotechnology and effective vaccines. Further, strategies should include point of care diagnostics, better surveillance system, and adoption of One Health approach to manage these diseases holistically. Then the conclusion of my presentation is hemoprotozoan disease continue to pose significant challenges to livestock health and productivity. Although advancements in diagnostics and therapeutics have been made, their applications in field conditions remains limited. An integrated approach involving early diagnosis, effective treatment, and proper vector control is essential for suitable management. Thank you. Thank you very much.
Thank you very much, Dr. Jadhav, for this highly informative and clinically valuable update. Your presentation provided excellent insights into the current challenges in diagnosing and managing hemoprotozoan disease in livestock. Thank you so much, sir.
Thank you, madam. Thank you. Thank you very much.
Ladies and gentlemen, with this, we successfully conclude technical session 1. I extend my heartfelt gratitude to all the esteemed speakers for their outstanding presentations and to the audience for your active participation and insightful interactions. We will now proceed to award ceremony 2. I request all the awardees and dignitaries to kindly listen your awards and name carefully. Thank you so much, and I commence the award. Dr. Omar Khalibaba, Category L, Best Veterinary Pathologist Award. Dr. P. Upadhyay Banu, Young Woman Scientist Award. Dr. Pallavi Chaudhary, Emerging Researcher Award. Dr. Pankaj Kumar Umar, Best Pharma Young Scientist Award. Dr. Patel Prapti Nikunj Kumar, Young Scientist Award. Dr. Prachi Dhaka, Young Woman Scientist Award. Dr. Prachi Singh, Dr. A.M. Thakur, Young Scientist Award. Dr. Pradeep Kumar Ramlal Parmar, Best MVSC Thesis Award. Dr. Pramod Kumar, Dr. R.D. Sharma Memorial Award. Dr. Praveen Maruti Madhabhai Young Scientist Award. Dr. Prerna Ghorpade Eminent Scientist Award. Dr. Priyanka Meena Young Woman Scientist Award. Dr. Priyanka Sharma Best Pharma Young Scientist Award. Dr. Rebe Begum Award Category A Outstanding Young Scientist Award. Dr. Rahul Sharma Best Teacher Award. Dr. Rahul Singh Rathore Young Veterinarian Award. Dr. Rakesh Nehra Best Oral Presentation Award. Dr. Ravindra Sivaji Tyade Best Teacher Award. Dr. Ridhi Vinod Bhai Young Scientist Award. Dr. Rukmani Devangan Fellow of Indian Society Award. Dr. Rukmani Devgana Fellow of Indian Society of Veterinary and Animal Husbandry Research Award. Dr. Sakshi Patel Best Woman Veterinary Pathologist Award. Dr. Salim Lav Navni Best MSc Thesis Award. Dr. Samiksha Mukesh Rose Best Woman Veterinarian Pathologist Award. Dr. Sandeep Narayan Rinde Fellow of Indian Society of Veterinary Animal Husbandry Research Award. Dr. Sanjeet Kumar Verma Best MVSC Thesis Award. Dr. Sanjeev Kumar Young Scientist Award. Dr. Shantanu Paul Young Scientist Award Gold Medal Award. Dr. Sariput Pandran Garao Langde Fellow of Indian Society Award. Dr. Satyavan Madhukar Young Scientist Award. Dr. Sedin Yu Suhao Young Woman Veterinary Pathologist Award. Dr. Shahista Sareen Lodhi Dr. A.M. Thekar Young Scientist Award. Dr. Sambhavi Best MSc Thesis Award. Dr. Sheen Tukra V.V. Rende Young Scientist Award. Dr. Shruti H. Inamdar Distinguished Scientist Award and Gold Medal Award. Dr. Shubhangi Nigam, Young Women Scientist Award. Dr. Shweta Chaudhary, Young Women Scientist Award. Dr. Roy Rangsang, Best Pharma Young Scientist Award. Dr. Subhash Chandra Mandal, Fellow of Society Award. Dr. Sudarshan Kumar, Best MVSC Thesis Award. Dr. Suganya, Young Women Scientist Award. Dr. Sunny Kumar, Best Thesis Award and Young Scientist Award. Dr. Supriya Shukla, Best Woman Veterinary Pathologist Award. Dr. Surendra Singh Shekhawat, Distinguished Scientist Award. Dr. Surya Pratap Singh Parihar, Young Scientist Award. Dr. Shushant Sivdas Sole, Outstanding Young Scientist Award. Dr. Shushma Mangesh, Excellence Award in Phytochemicals. Dr. Swati Ashok Rao, Best Pharma Young Scientist Award. Dr. Swati Gupta, Best Teacher Award. Dr. Shama Takmani Tripathi, Fellow of the Society Award. Dr. Sylvia Dr. A.M. Thakur, Young Scientist Award for Women. Dr. Tote Eliza Salikrem, Young Scientist Award. Dr. Umesh Saligram, Best PhD Thesis Award, and Lal Bahadur Shastri, Outstanding Young Scientist Award. Dr. Urvashi Chaudhary, Young Scientist Award. Dr. Utpal Shailesh Bhai Patel, Best Veterinary Pathologist Award. Dr. Vedai Mishra, Young Scientist Award. Dr. Vipin Chand, Best PhD Thesis Award and Young Poultry Scientist Award. Dr. Vishambar Dayal Sharma, Lal Bahadur Shastri, Outstanding Young Scientist Award. Dr. Vishwaranj Upadhyay, Young Scientist Award. Dr. Charan, ISVHR Excellence Award in Ruminant Research. Dr. Chongtam Sonia, Young Women Scientist Award. Dr. Gagan Chawla, Best MSc Thesis Award. Dr. Ganesh, Young Scientist Award. Dr. Hemlata Chauhan, Emerging Scientist Award. Dr. KL Chanmihna, Society Award, Young Scientist Award. Dr. Praveen Bano, Young Women Scientist Award. Dr. Rashmi Kulesh, Young Women Scientist Award. Dr. Sakshi Vijay Tripude, Best MVSC Thesis Award. Dr. Shubhangi Varke, Fellow Award. Dr. Rashmi Vishwakarma, Young Women Scientist Award. Dr. Shivani Upadhyay, Young Women Scientist Award. Mamta, Best Veterinary Scientist Award. Manisha, Dr. A.K. Bhargava, Memorial Award. Mr. J. Swaminathan, Best MVSC Thesis Award. Mr. Kushwant Singh Barar, Fisheries Extension Excellence Award. Ms. Ali Aristha, Best MFSC Thesis Award. Ms. Kiran Gohad, Best MTech Thesis Award. Ms. Simranjeet Kaur, Young Fishery Scientist Award. Mr. Surbi Saho, Best MFSC Thesis Award. Ms. Ali Aristha, Best MFSC Thesis Award. Prajwalini Singh Thakur, Excellence in Veterinary Research Award. Preetam Pal, DC Blood Gold Medal Award. Professor Kalyan Sharma, Dr. C.M. Singh Memorial Award of Excellence. Professor Prakash Bhatt, Fellow of the Society Award. Professor Song Ser Watson, Fellow of the Society Award. Professor Dr. Suneet Wankhede, Best Teacher Award. Pulkit Chok, Young Scientist Award. Satya Prashant, Young Scientist Award. Sonu, Best MVSC Thesis Award. Yuvraj Singh, Veterinarian Student of the Year Award. Sudarshan Kumar, Young Scientist Award. Dr. Tripti Kumari, Jawaharlal Award for PG Outstanding Thesis Research Award. Dr. Jasmeet Singh, Fellow of the Society Award. Dr. Kumari Anjana, Dr. A.M. Thakur, Young Scientist Award for Women. Dr. Prayash Ranjan Sao, Young Scientist Award. Dr. Sanjay Kumar Bharti, Fellow of the Veterinary Animal Husbandry Research Society. Dr. Lithikan B.N., Best MVSC Thesis Award. Dr. Neha Pure, Jawaharlal Nehru Award for PhD Outstanding Thesis. Dr. Imtiwati, Young Scientist Award. Dr. Swapnil Maravai, Best MVSC Thesis Award. Dr. Belesha Selu, Dr. C.M. Singh Memorial Award of Excellence. Dr. Yatish H.M., Young Scientist Award. Dr. Diljit Kaur Chhabra, Distinguished Scientist Award. Dr. Fareen Ansari, Best PhD Thesis Award. Dr. Yash Sharma, Best MVSC Thesis Award and Young Surgeon Award. Dr. R. Lakshmi, Srimati Kamala Madan Memorial Award. Dr. Shubham Avachare, Best MVSC Thesis Award. Dr. R. Lakshmi, Srimati Kamala Madan Memorial Award. Dr. Tripti Jain, Emerging Scientist Award. Dr. Shivani Upadhyay, Young Poultry Scientist Award. Dr. Namita Shukla, Excellence in Veterinary Research Award. Dr. Barkha, Inspiring Leading Veterinarian Award and Outstanding Thesis Award. Dr. Monica Soni, Young Dairy Scientist Award. Dr. S. Yogesh Priya, Inspiring Lady Veterinarian Award. Dr. Piyush Kumar, Best MVSC Thesis Award. Dr. Hemlata Valmiki, Young Dairy Scientist Award. Dr. Rakesh Nehra, Best MVSC Thesis Award. Dr. Bishwadeep Bahera, Professor, K.R. Iyer Memorial Best MSc Thesis Award, and Lal Bahadur Shastri Outstanding Young Scientist Award. Dr. Patil Harshal PhD Thesis Award, Best MBSc Thesis Award. Mr. Alvin Peter M. Best MFSc Thesis Award. Dr. Nagendra Singh Young Scientist Award. Dr. Manoj Kumar Ahirwar Eminent Scientist Award. Professor Jonali Devi Excellence in Veterinary Research Award. Miss Indulata Tekam Best MFSc Thesis Award. Professor Dr. Kamal Sharma Best Veterinary Scientist Award. Dr. Prajwalini Singh Thakur Excellence in Veterinary Research Award. Dr. Bhavna Ahrwal Eminent Scientist Award. Dr. Rinkesh Namichan Best Young Scientist Award. Dr. Uma Manohar Tumlin Award for Excellence in Research, that is Young Women Scientist Award. Dr. M. Veer Selam Eminent Scientist Award. Dr. Bharat Shinde Best PhD Thesis Award. Dr. Barkha Gupta Inspiring Lady Veterinarian Award and Best PhD Thesis Award. Dr. Alok Kumar Chaudhary Fellow of the Society Award. Dr. Rohit Barwar Best MSc Thesis Award. Dr. Papia Das Society Young Women Scientist Award. Dr. Piyush Kumar Best MBSc Thesis Award. Dr. Sanjay Bharti Fellow of Indian Society of Veterinary and Animal Husbandry Research Award. Tarun Kumar Young Scientist Award. Nagendra Singh Young Scientist Award. Uma Tulam Award of Excellence in Research. Oli Priya Young Women Scientist Award. Dr. Ajay Kumar Dung, Dr. V. Kuranian Award. Dr. Sumit Singhal Award of Excellence in Research. Dr. Shantanu Pal Young Scientist Award, Gold Medal Award and Best MBSc Thesis Award. Dr. Pratyush Kumar Young Scientist Award and Dr. Sanjeev Rajan Best Teacher Award. So here we come to an end of the award ceremony. And here I thank you all for all of your presence. With this, we come to the end of today's academic proceedings. Once again, thanks to all the speakers, organizers, sponsors, delegates, and volunteers for making this session really a grand success. Thank you so much. Have a wonderful evening. We'll meet tomorrow for oral and poster presentations. Thank you so much.